Good morning and welcome to the Portuguese Institute of Oncology of Porto. On behalf of the World Health Organization Regional Office of Europe, the Portuguese Minister of Health, the Executive Board and the General Secretary of Minister of Health, it is my great pleasure to welcome you to the first regional dialogue on AI for health. Today, we are honored to bring together international experts, national authorities, and the newly appointed EU Technical Advisor Group on Artificial Intelligence for Health. We gather here to explore one of the most pressing and fascinating topics of our time. Now, artificial intelligence can transform healthcare while safeguarding the values of humanity, ethics, and responsibility. This conversation is particularly meaningful here at EPO Porto, where science, care, and compassion meet every day. Artificial intelligence is not only about technology, it is about people. It is about patients, families, clinicals, and researchers. Today, we will reflect on how to ensure that innovation serves human dignity, equity, and trust. I invite you to keep this spirit in mind throughout the session. To officially open today's session, it is my great honor to invite the President of the Board of Directors of EPO Porto, Dr. Júlio Oliveira.
Professor Dr. Ana Paula Martins, Minister of Health of Portugal, Dr. Natasha Muscat, Director of the Division of Health System of WHO, Professor Dr. Álvaro Santos Almeida, Executive Director of the National Health Service of Portugal, dear speakers and moderators, dear participants. On behalf of Portuguese Oncology Institute of Porto, it is my great honor and pleasure to welcome you all. We are privileged to host this significant event organized by World Health Organization, the Executive Directorate of Portuguese National Health Service, and the Ministerial of Health. The theme that joined us today, Health, Humanity, and AI, building a responsible future, is not just timely, it is essential not only for the health sector, but for the entire humanity. Here at IPO Porto, the only Portuguese comprehensive cancer center, we fight cancer every day. And we witness firsthand the immense potential of technology to save and improve lives. We also feel the weight and the profound ethical responsibility that comes with it. Artificial intelligence presents itself as a new frontier of hope. For earlier diagnosis, for personalized treatments with new medical devices and drug development, and also for more efficient healthcare systems. But this new frontier must be navigated with a clear moral compass. The humanity, today's title, is not, it's not an afterthought. It is very profound. It is a very foundation upon which we must build. Our discussion today on governance, application of the technology, patient rights, and ethics are critical. They are about ensuring that the algorithms serve people, not the other way around. That they reduce rather than exacerbate inequalities. That they support our clinicians, most importantly, protect our patients. As a host institution dedicated to cancer care, research, and teaching, we are committed to be an active part of this responsible future. We look forward to learn from the distinguished speakers and the panelists and to contribute with our own practical experience from the front lines of the oncology. My sincere thanks to the World Health Organization for choosing Porto and IPO specifically for this vital dialogue. To all the participants, speakers, and organizers, thank you for your commitment to this cause. I wish you a most productive and inspiring day. The success of this event lies in your engagement. Thank you.
I have the pleasure to invite Professor Dr. Álvaro Santos Almeida, Executive Director of the Portugal National Health Service Executive Board, to take the floor.
Morning. Honorable representatives of the World Health Organization Regional Office for Europe, members of the Technical Advisory Group on Artificial Intelligence for Health, Professor Júlio Oliveira, President do IPO, distinguished guests and speakers, good morning and welcome to Porto. As the Executive Director of the Portuguese National Health Service, I am greatly honored by the opportunity to take part in this important, highly relevant event. This gathering marks a significant moment. It brings together international experts, national authorities, and the newly appointed Technical Advisory Group on Artificial Intelligence for Health. Together, we will reflect on the opportunities and challenges of artificial intelligence and how we can build a responsible future for its use in healthcare. Portugal is proud to host this dialogue in the context of close collaboration between the World Health Organization Regional Office for Europe, the Ministry of Health, and the Portuguese NHS. This partnership is built on a common ambition to share knowledge, strengthen cooperation, and achieve the highest possible level of health and well-being for all people. We want innovation that truly improves the way we care for people. Technology must serve patients and support health professionals in their daily work. In today's world where health systems face growing complexity and constant change, our responsibility is clear: to ensure that progress in artificial intelligence translates into safer, fairer, and more effective healthcare for all. We have a principle that I want to state clearly. We see AI as a tool that can support health professionals, not replace them. In several hospitals, including here at the Portuguese Institute of Oncology in Porto, AI-assisted tools are helping us deliver personalized care and optimize workflows. These innovations can improve efficiency and patient safety, but only if we address key challenges like security and data quality. This is what we mean when we speak of delivering tangible benefits at the operational level. Ethical guardrails, robust governance, and strong data foundations are not obstacles to progress. They are the very conditions that make progress safe, scalable, and trustworthy. During today's sessions, we will learn from the experiences of other European countries, discuss what is needed to implement AI in Portugal, and reflect on the rules and safeguards that must guide us. We will also look at how AI can improve quality of care and patient safety when it is used responsibly. On behalf of the Portuguese NHS, I thank you for being here and for your commitment to this shared mission. I wish you a productive, candid, and inspiring dialogue. Together, let us ensure that AI strengthens health systems, upholds human dignity, and advances the highest attainable standard of health for all. To all participants, I wish a productive, inspiring, and impactful conference. Thank you very much.
Distinguished audience, dear colleagues, I hope that you can hear me well. And it's my pleasure also to say good morning and welcome to our members of the Technical Advisory Group on Artificial Intelligence. Thank you for making the time to support WHO in this important initiative. And also colleagues from the Portuguese government and the Serviço Nacional de Saúde. And I'm sorry I could not be with you in person, but at the moment there are rather difficult days for us at WHO Europe as we are undergoing, as some of you might be familiar with, restructuring and downsizing and letting a number of staff go. Having said that, our countries are still wrestling with several issues in their health systems, and of course, not least, the whole opportunity, but also challenging landscape around artificial intelligence. And therefore, it's my pleasure to warmly welcome you to this regional dialogue on AI for health within the WHO European region. Of course, there is no question about it. AI is here and is already transforming and reshaping the way health systems deliver service, are planned, and are governed. And our region has been advancing AI in governance and in many ways is acting as a laboratory from which other regions can learn. And the speakers and panelists here today bring an extraordinary wealth of disciplines, perspectives, and experiences. And it's this transdisciplinary approach that we very much need to guide our activities as we go forward. And this diversity in itself reflects the complexity of the topic that we are dealing with. And throughout the dialogue, I'm sure we are going to hear about the cross-cutting areas that are essential to make successful use of AI in health, including policy, regulation, legal frameworks, ethics, explainability, privacy, security. But allow me to highlight some of the key areas that we need to focus on. Successful use cases of AI in health. What has worked and what has not worked? Yesterday, at a hearing that was organized by the European Parliament by the Sant subcommittee, where WHO was one of the expert organizations that was invited to address the pressing issue of the health workforce crisis. At one point during this hearing, somebody said, please, I do not want to hear AI mentioned again. AI is being flagged as the solution and it is not a panacea. And I think this is really very much where we are. In the space between being able to acknowledge where AI can, is already making, and can make more of a contribution to solve some of the pressing issues that we are facing in health systems, and where it cannot. And it's this honesty based on scientific evidence which we as WHO, with you as the experts, hope to be able to take forward. Because there are many unanswered questions, such as, for example, liability standards for AI products and their use, protection of patient rights, the urgent gaps that we need to close when it comes to digital literacy, AI literacy amongst the healthcare workers, but even more so among the general population. Only 1/4 of our member states in the European region currently offer in-service training for the workforce. We cannot wait just for the new generation Alpha Z workforce to be the ones using these technologies. There's a whole workforce out there that needs to be trained coached need to be given not only the competence, but the confidence and the security to be able to use these technologies effectively, because patients take their cues from the health workforce. So first and foremost, the science. What works, what is working, and where is this potential that remains untapped? Secondly, taking that science into practice, engaging with the health workforce, engaging with the patients. I'm really sorry that I'm going to miss the exciting debates that you're going to have today, but this is a conversation which is only starting with the generous support of the Government of Portugal, without which we would not be able to have these events. And I say it's the start of a conversation which will intensify, and I very much look forward to being in Portugal for the next event. Thank you, and back to you.
Thank you, Dr. Natasha Azupardi Muscat, Director of the Division of Health System at Europe. To conclude the welcome remarks, it is my honor to introduce a video message from Professor Dr. Ana Paula Martins, Minister of Health of Portugal.
Dear colleagues, dear friends, it is a great pleasure to welcome you all to this important conference in Porto. Today, together with the WHO Regional Office for Europe, we are marking a milestone in our shared commitment to transform health systems and to continue advancing the health and well-being of our population through innovation, digital technologies, and artificial intelligence. For Portugal, investing in AI for health means investing in stronger, more resilient health systems and in better care for our more than 10 million citizens. Data and digitalization know no borders, and we are convinced that digital transformation must follow a path guided by strong regulation, ethical standards, and above all, attention to people and their needs. Technology must serve patients and professionals, not replace them. And this is why research, education, and capacity building are at the heart of our partnership with WHO Europe. We want to ensure that our workforce is prepared to harness the potential of digital health and artificial intelligence in safe, equitable, and effective ways. I wish to thank Dr. Hans Klug, Regional Director of WHO Europe, for his leadership and his friendship. His dedication and vision have been essential in bringing us together today. I look forward to the discussions of this conference and to the lessons we will take from it, but not only for Portugal, but for all the countries in our region. Thank you very much.
Thank you. I will now kindly ask everyone to gather for an institutional photography of this session. Please stand. Yes. So everyone, just smile. Thank you all. Now, we will begin the first presentation of today's session, Transforming Health Through Artificial Intelligence, a EU-Europe-Portugal initiative. It is my pleasure to invite the speaker, Dr. David Novillo Ortiz, to take the floor.
Bon dia, good morning. Being from Spain is making me feel home here in Porto. So thank you so much for hosting us, Professor Almeida, Professor Oliveira, Professor Oliveira for having us here today. It's going to be a long but very productive day. And the idea of this presentation is just to showcase a bit the work that the World Health Organization is conducting at the moment on digital health, but particularly on artificial intelligence. And then to discuss, to show you the partnership that has been mentioned from Dr. Asopardi, from Dr. Almeida, about the work that we are doing thanks to Portugal. And we're still grateful for that. And I would like to take this opportunity to thank again to the government for the strong support to WHO, not only in this area of work, but on anything related to public health, to really move and to improve the population, the health of the population in our region. I will go very briefly through three components. First, just on global regional mandates when it's about digitalization in the European region. Then some regional updates from the World Health Organization. And finally, I will go in detail in the partnership between WHO Europe and the Portuguese government. About global and regional mandates, it's always important, particularly when it's about health, to have common agreements and understandings in different areas of work, and particularly in digitalization. Right? So in 2021, what we agreed at the global level with the 193 member states of the World Health Organization was to agree in a global framework in how to move forward all together in the digital transformation of the health sector. Then 1 year later, what we did in the European region, that's for you that don't know, we cover 53 countries, so it's the complete European Union plus 26 countries. We put forward a regional action plan to also move as a region together in this area of work with 4 specific pillars. One related to setting norms and technical guidance, because if there is an area of work that requires further research, as the minister said, is digitalization in the health sector. Then another important component related to digital literacy, how we are increasing our health workforce, and we are providing this knowledge to the population when it's about digital transformation. Also about this knowledge exchange and networking that is needed. All countries, without exception, at the global level are moving in this area of work, so it's good that always we touch base and to share lessons learned, particularly from the failures, that's something that we are not usually doing. So sharing the failures is particularly relevant when it's about this area of work. And finally, the last priority is to try and, from this knowledge that we are getting from different countries, try to scale that up to see what is working well, right? There are good experiences, for example, during the COVID-19 pandemic, we had the COVID-19 digital certificate that was used widely in the European Union, that now is used actually for other public health use cases, that it will get us at some point to full interoperability when we are traveling or being out of our home country. Moving to regional updates, I always like to mention 3 positive things about our region and 3 things that we could do better. When it's about things that we are doing relatively okay, it's about having frameworks, governance around digitalization. So in our region, in comprising, of course, these 53 member states, countries that I mentioned, 83% have a national digital health strategy or policy. National strategies are usually very useful to really have a roadmap of what is happening. And this is particularly when we have transitions in governments, this is usually what is giving stability and continuity to these efforts. With 87%, we have seen that widely in our region, electronic health records are very well implemented. I am not referring to the interoperability between the systems, but at least we know that the digitalization of the medical records are widely digitalized. And finally, when we conducted this survey, we observed as a positive finding that 78% of our countries have already included telehealth, telemedicine within the healthcare services. That is something that has been growing up from decades ago, and that during the COVID-19 pandemic also the use was expedited. When it's about things that our region as a whole could do better, there are three important components. The first one is about digital health literacy, right? When we are working in this area of work, we know that we are doing huge investments, so there is a lot of responsibility for decision makers investing in this area of work rather than others. So we see that there is a lack of this translation of investments overall in digital transformation when it's put in the curricula of health science, right? Natasha, our director, mentioned also in her presentation, in her points, that we have seen that when it's about AI, only just a few countries offer in-service training in the health science curricula to the current students of health science. So that is something that we are working together, and we are super proud that we are doing that also along with Portugal to move and to change that dynamic in how we can improve the digital literacy of the health workforce and the population. The second red flag when we were conducting this study was about the evaluation of these digital health interventions. We know that it's very fancy to use digital solutions to be applied in health, but we are missing this evaluation component about what is the real impact of that. So we have noticed that not in all countries there is a clear mechanism to monitor and to evaluate how these digital solutions are having an impact in the health workforce and in the population. And that is something critical that we also need to move together to really improve. And finally, in the age of AI, as we know, the most important piece of this trend is the data. And unfortunately, when looking at this, we can see that only a quarter, a little more than a quarter, have a strategy when it's about health data governance. So that is critical. We know that there's a lot of data there, but of course I don't want to talk about that because you're going to have full discussions during the day about that. But we know as a red flag that our countries want to move very quickly on AI without having the principles already set to really move in a safe environment. When it's about work that we have been conducting as WHO overall, when I said overall, it's also our global level. Our office is based in Copenhagen, in Denmark, covering these 53 countries, and then our headquarters for WHO is based in Switzerland, in Geneva. And working together, we have developed some guidance pieces so far, right? Related to ethics and governance, medical devices, regulatory frameworks, and that is the main priority at the moment. We are very concerned about the ethical and regulatory components, and that is our priority when working in this area of work. We also have an alliance with the International Telecommunications Union, the ITU, that as WHO is the UN Agency for Health, the ITU, the International Telecommunications Union, is the telecommunications agency for the UN system. So we partner with the ITU to really move in this area of AI in health, because of course we cannot move without the technology part, but more importantly is the health component. And we created a strong alliance with 24 different working groups. The final report has been published recently, and you can see here the working groups in which you can appreciate the amount of topics that have been discussed in this group. That goes through cardiovascular diseases, through mental health, through traditional medicine. So I think that all the relevant components are currently covered by this working group, composed of experts on technology, but also in health. There is also another global initiative on AI for health that is also composed of the World Health Organization, the International Telecommunications Union, and the World Intellectual Property Organization, because we are very concerned about the privacy rights and the data of the population. So we are really prioritizing that as the main component of the work that we are conducting in AI for health. When it's about the work that we are conducting in WHO Europe, we have so far in the last 3 years published close to 60 technical guidance pieces of evidence and guidance in AI in health overall. Then we have also trained more than 10,000 people so far in components related to digitalization or transformation in the health sector. And we have provided support to more than 40 countries at the moment in this area of digital transformation that goes through how to transform a paper-based system to how to implement AI projects in a country. So it's quite diverse. Now moving to the most important component that I'm sure that you may be very well interested is this partnership that has been mentioned in the welcoming remarks. We are extremely grateful, I won't be tired to repeat it, of this partnership and support received from the Portuguese government to really move and to make a change on AI in health. So this is the kind of things that people will remember in 10 years from now. Now it could be like just a simple thing, but I can assure you that in a few years from now, everybody will remember this kind of partnership and the impact that it took not only for Portugal, but for the population of the European region. Here you can just see a follow-up meeting between Dr. Kluge and Dr. Martins, Professor Martins, last week when they were meeting in Wonka, that actually, if I am not mistaken, took place in Lisbon. So you can see that Portugal is quite in the center of everything that we are doing in the European region, particularly for digital health. And I am quoting now because I am remembering talking yesterday with our regional director, with Hans, to ask me, please, don't forget to repeat that Porto for us is the gravity when it's about high-level events and activities related to digital. And it's true. 2 years ago, we were in this same city organizing a big symposium with more than 500 people about digital transformation. So we are very proud that today we are here again doing exactly the same and moving the digital agenda for the European region. As part of this partnership, there are some overall objectives. There is a firm commitment to use Portugal as our center, not only to pilot, but to extract all the lessons learned that the government is currently conducting at the moment from different projects, and then to get also this experience to other countries, but also learn from others, with the objective to have, at the end, a regional strategy on AI for our 53 countries. This is something that our member states are demanding us at the moment. The idea is that now in November, we are presenting a study on the current status of AI in health for our 53 member states. And with this baseline, we are ready to move as a science-based, evidence-based organization to move with a regional roadmap using this data to propose a plan for our 53 member states that hopefully will be approved and endorsed by 2026. As part of this, some activities that I would like to mention that are critical and we would like to share with you. So when it's about addressing public health and challenges and problems, there are 3 particular areas that we are very committed. One is health workforce. No need to say, there is a shortage of health workforce. We are aware that by 2030, overall, there will be a shortage of around 25% of medical doctors. I am talking general terms, not in Portugal, overall. So that is a real challenge, how we are going to work with this gap of medical shortages from now in a few years. That is just around the corner. Also mental health, no need to say, is something that is really the top priority for us at the moment. We are receiving requests from all the member states about this. Not to mention about, in all the dimensions, of course, that we can look at mental health, particularly the youth population, social media impact, what is happening. I think that there is a current debate in every single member state about what to do with social media and the youth population. So this is very relevant and pertinent that we are all working together in finding solutions for these problems. And then, of course, quality of care and patient safety that we have already mentioned. And we had the pleasure to have today Dr. Professor João Breda, heading our quality of care and patient safety office based in Greece, that he will be with us today along the day. Then also, we have explored and agreed to develop kind of hackathons, activities that will provide that we can have this kind of challenges to help us to play with the data that we know that is there. So we are also trying to, over these months, to have this kind of activities that will help us to dynamize this particular area of work. When it's about regional leadership and country support, one of the main milestones was to establish the technical advisory group. It has taken us time to do it, but we are very proud that after receiving almost 400 applications, we came up after geographic balance, gender balance criteria to have 10 wonderful experts that are, 7 of them are here with us today, and you will have the pleasure to learn from them, as I will be learning too. And tomorrow we'll have the first meeting. So again, that is a milestone for us, that Porto is the center for this first meeting that the Technical Advisory Group on AI for WHO will celebrate, to advise not only our office, but our region about what should be done in this special area work. Also, as I have mentioned before, we plan to develop this regional roadmap. And then, as part of this regional leadership and country support, we are fully committed to export what Portugal is doing in this area, but also to bring experiences from outside to strengthen the Portuguese government when it's about AI. So I think that is a win-win, not only for Portugal, but overall for our European region. When it's about what else we should be doing in this area of work, particularly from a guidance point of view, something that I have just mentioned is this report that is due in 19 November. It will be launched with an overview of what is the status of AI in health. And we will definitely, we can assure you that that report will have a before and after, because it's going to drive us about what should be done in this area for the coming years. Also, we are looking at how artificial intelligence is having an impact on climate change and antimicrobial resistance. So there are a few topics that we already know that is going to have an important impact. So we're already looking into this to really be ahead of the curve, to really start doing some actions that can help not only us, but all the countries in our region to move in these areas. Another important topic is to develop a readiness assessment and capacity tool for the member states, because sometimes we are used to see how member states move in isolation, particularly from hospitals, because the innovation is there, right? So it's difficult to move as an overall country, as a whole, in this area. So of course we know that innovation usually happens in hospitals, like this one. So with this, what we are trying to do is to develop tools for the member states to really know where they are and how to move to the next level. So that is something that we are currently working at the moment. And then we're establishing knowledge communities, kind of communities of practices that I'm sure that all of you are aware of that kind of methodology around this area. If there is an area of work in which we still are lacking a lot of evidence, is artificial intelligence. So you can go to the literature, you can review, there are some important findings there, but unfortunately, we have a lot of knowledge, as many of you may have, that are still not in the literature. So with this kind of knowledge communities, what we're trying to do is to gather all this knowledge and to put it in piece of reports that can be widely shared and be used with the purpose of complementing what is already published in the literature. And finally, how we are going to continue strengthening this capacity. So we have also agreed that we will use Portugal to organize a high-level event on artificial intelligence with experts from different WHO regions, of course, with our European region, but also with the Southeast Asia region, and also with the Middle East, Eastern Mediterranean region. So the idea is to bring experts from other countries, not only to meet here, but also to learn from Portugal, to have some particular activities with Portugal, and then to also to share this knowledge. And finally, and perhaps one of the main milestones that we have, and we are working together with the government, is to develop an executive course on AI in health. That is something that is very much needed, with the idea that this could be a scale up to the curricula of health science, not only in Portugal, but across the European region. So, as you have seen, we have very ambitious plans. Please note that this is just an appetite of what is already been discussed and agreed. So don't think that this is just about that, but these are just some activities that we consider that are important for you to know today. And again, I would like to thank all of you for the opportunity of being here, and I hope that you will enjoy, as well as I will enjoy, learning from the experts that we will have today. Thank you so much for joining us today. Thank you.
Thank you very much, Dr. David Novillo. We'll now take a coffee break for 30 minutes. And now we move to our Fireside chat on IE in health, lessons learned from Finland, France, Germany, and Uzbekistan. This Fireside will be moderated by Mr. Tyrone Redden, Technical Officer of Performance, Knowledge Management and Artificial Intelligence at U Europe.
Good morning, colleagues. How are you today? Fine? Yes? You have to say it. Okay. So, I hope you're doing well. So my name is Tyrone Redensi. I'm a technical officer for knowledge management and artificial intelligence. And I'm here to host a fireside chat. Anybody knows why it's called a fireside chat? You think we're barbecuing a human today or what? Okay, so I did ask, who do you think I asked what fireside chat is? Exactly. Thank you. So, fireside chat is an informal conversation. This is not going to be a panel. This is an informal conversation, warm, as if friends and family are sitting around the fire, talking about casual topics. So, please expect that I will be asking you, the floor will be open if you want to participate in the chat. This is not a conversation among four people. This will be a conversation amongst ourselves. Ready? Yes? I hope you're caffeinated and already full because we are having a conversation, okay? So, colleagues, thank you again for being here today. I'm with the distinguished experts of the Technical Advisory Group for Artificial Intelligence on the WHO European region. Maybe I can ask our experts to introduce themselves in one sentence, and maybe as a twist, I would like, here's the twist. If you were a plant, what would you be and why? A plant. Yes. If you were a plant, what would you be and why? So I promise this is the last twist of the morning. Okay, Dr. Vikrov.
Let me start. I'm Igor Vikrov from Uzbekistan, and if you will be a plant, I will be, I don't know in English the word, but I know in Italian somehow, I will be a Gerizolli. Yes.
What is it? Sunflower. Okay, Dr. Vikrov, why a sunflower?
Because I'm from very, very hot country, actually, a lot of sun. So that's why I'm son of sunflower, yes.
Okay, хорошо. Okay. Okay, Dr. Vikrov, you work in specifically in AI, you mentioned, and you were a pediatric surgeon by training. Okay. Eva, do you want to go next?
Sure. Hi, everyone. I'm Eva Weiken. I'm Chief Medical Officer of the Fraunhofer Heinrich Hertz Institute in Berlin. I'm a medical doctor by training, and I'm motivated by bridging clinical reality with AI science, and I'm happy to be here.
And which kind of plant are you?
Right. So I think I would like to be a palm tree.
Mm-hmm.
Yeah.
Why is that?
Because I like palm trees.
Okay.
They are.
Fair enough. Okay. All right. Yuka, you want to go next?
Yes, hello everybody. My name is Jukka Läsmaa. I'm a senior advisor at the Finnish Ministry of Social Affairs and Health. And I have the most interesting work in the world. I'm coordinating the research, development and innovation as well as competent development activities in the field of healthcare, digitalization and health technology. And I think I have to echo with Eva here because this is obvious. I would also be a palm tree because Jukka palm tree, at least in Finnish, it is exactly my name, Jukka palm tree. You know Jukka palm tree, yeah.
I see. So we learned Finnish today, huh? So, okay, so I think it's my turn. if I were a plant, do you know the plant angel's trumpet? Do you know that plant? It's very fragrant. It smells like soap, and if you smell it, you literally smell. It smells like soap. So I love that. I don't know why. I don't smell like soap, but I love that plant. Okay, so now that we know which kind of plants we will be, then let's go to the Fireside chat. And remember, colleagues, you're an active participant in this chat. Okay, so. We know across Europe and Central Asia that AI in healthcare is at very different stages, you know, from Western Europe, Central, Eastern, Southern, it's all very, very different. So let's start with the opportunities and challenges that you see most clearly. So in one line, what is the biggest promise and the biggest risk of AI for health for you? Who wants to go next?
Yeah, let me try.
Dr. Igor, go ahead.
In Central Asia and in Uzbekistan particular, the biggest hope is that it will solve the, let's say, public health problems concerning the less developed literacy and competence and doctor shortage, and also concerning the insufficient funding opportunities for healthcare, and also with the high population growth. Just to make some figures, in Uzbekistan every year we have 1 million newborns, and until 2050 its forecast is 100 million will be in total population in Central Asia. So we just have not enough money, funding, and doctors. And we hope that AI will help at this point of view, because the bottleneck of every single healthcare system is a very good doctor. It's a bottleneck. And with the support of AI, we could improve the situation. So this is the biggest hope that we have, I think. And the dangers and the issues is that because we are highly centralized countries, centralized I mean in government and in everywhere, so it's could be mistakes that will take every single people and human being. So it's very dangerous somehow. So we need more public consultation, in my opinion, in the process of implementation of AI in healthcare. Thank you.
Thank you. Eva, you want to go ahead?
Sure. Yeah, so I think AI will somehow revolutionize like healthcare, because it can be beneficial in so many different applications. If you think about decision support systems or large language models that are already like take an administrative burden, for example, from hospitals. So I think there's a huge promise for AI, but at the same time, I think it's very challenging, and we need to see that we keep pace like with this rapidly evolving science or like development of tools or of AI, and really bridge this gap from development into application, and to guarantee that the AI also is useful in the end. And I think it's very important that we work on this now.
Thank you. Yuka?
Yes, Tyrone, I have to start saying that that big question. You promised that you are not going to burn us over here for the fire, but I'm trying to answer something here. I think that my biggest hope here is that we as a human beings, we are able to harness the full potential of AI for the benefit of humankind, for us as a humans to be the best versions of ourselves, so we can focus with the communications between the different people, and use the AI to help us in that. And then the biggest threat is the other way around, that we are not developing the AI solutions in a human-centric way. We are not in the driving position, but we are replacing humans in places where we don't want that to happen.
Thank you. Okay. Anyone from the audience who would like to contribute to this conversation? What is the biggest risk and benefit of AI in healthcare? Anyone? Okay, let me warm up the room. So raise your hand if you think that large language models, such as ChatGPT, should be used in the clinic. Okay, all right. And those who think that it's not? Okay, yeah. And should doctors be trained in prompt engineering? Yay, yay, okay. All right. And do you see any, have you been trained on prompt engineering? Okay, interesting. Yes, that's nice. I like ChatGPT very much. Okay. Yes. I like ChatGPT 5 very much. I hate ChatGPT 5 very much. I hate ChatGPT 5, sorry. I have bias with ChatGPT 5. Have you used it? Which is better, 4.1, 4.0, or 5? 4.0. 4. No, it's not good. Yeah, 4.1, 4.0 is better at programming. Who likes Gemini? 4.1 at least, 4.1. Yeah, better, yeah. Who likes Gemini? Sorry. Okay, all right, that's nice to hear. Anyone who likes to contribute on this conversation? Why you think that, what's the biggest risk and pitfall of AI? Or benefit? Yes, can we give a microphone? Thank you very much.
Good morning. Miguel Cabral, public health medical doctor in local health unit of São João here as a neighbor. One of the risks, I think, that exist is the inability to treat AI in its various forms. Because we keep on talking about AI as one single thing, when in fact there's multiple things already among us and have been for decades, but we're focusing only on large language models, at least as a buzzword or expression, as we might say, when there's different levels and shades to the topic. And so I fear that we might miss opportunities, and linking the two together, of using only parts or specific areas or applications of AI just because we keep on looking to the almost general artificial intelligence, AGI, in the context of trying to use something that is ever increasing or growing, while perhaps simpler things, even small language models, who are now becoming a thing also, might be more adequate for certain parts of activity. Because one of the challenges that you were mentioning, and I'll shut up, don't worry, one of the examples that you were mentioning of using it in the clinic, of course, but in which part of the clinic? Because
and what kind of AI? Yeah.
Exactly. So that would be my contribution.
Thank you. Anyone else in the floor?
Maybe I can.
Yes, Eva, go ahead, please.
Because yeah, I think it's an interesting statement and remark, and like I also feel it's important to create evidence, like that LLMs, for example, are useful in clinical settings, And for example, at HHI, we did a pilot study together with a university clinic in Berlin where we investigated in a pilot project what kind of legal aspects are needed to use cloud-based but also local LLMs in clinical settings. And this was then published also in a paper. And it could be one example how to address or how to find like a way how to use it and to make it more usable for also like other settings. And like after having like the ethics vote and also like this legal report, that was kind of a basis for conducting a clinical study like on guideline compliant treatment with LLMs for chronic diseases. And I think we need these kind of clinical studies that really prove evidence like that we can use it, but that also show, okay, what doesn't work or what didn't we consider when we thought about it in silico, kind of.
It sounds like a realist evaluation of what works for who in what situations and in what and why. Sounds like something that needs to be done.
And also to look into user needs, like what is really needed by doctors, by nurses, by healthcare professionals, also by patients. And I think it needs more studies to investigate this. Also how AI maybe will change the working environment.
Yeah. Okay, thank you. And maybe here I can pivot to you, Jukka. And maybe you can tell us, what does the AI ecosystem in Finland look like, and how is it organized, this health AI collaboration?
Yes, thank you, Tyrone, for this question. So in Finland, we truly believe that AI development is a joint venture of public, private, and academia. And we have to keep all these stakeholders involved in the development. And this was the main and I would say even only reason why we established this health AI ecosystem in Finland. So it is a joint venture for all of these organizations to join. And we have more than 250 organizations now in the ecosystem. And to give you some kind of features of the ecosystem, and this is kind of our ministry's perspective for the activities. So some of the main components are that we have started pilot projects for the most interesting user cases of health AI in there, partly funded by our ministry. But then we have also formed this kind of umbrella over all the development on AI that is happening in our welfare counties. This is a benefit for being a small country. We can do things like that. We have an overview of all of the development in our welfare counties, from what is happening over there. And now we are coming to the selfish ministry's perspective for this. Of course, we are hoping that these pilots and developments, they will produce good care and benefit for the customers and for the system and things like that. But from the ministry's perspective, we are utilizing these projects to collect feedback. What are the most important development needs of our current legislation based on the concrete examples from this? I could go on and go on with the other features of the ecosystem, but you will get bored, so let's have other questions.
So maybe if I can prompt you, Jukka, what you mentioned about this joint venture, what was like one of the most effective technique that worked well when you did all this joint venture consultation that maybe our Portuguese colleagues can also hear about?
Yeah. So we started this ecosystem by doing a study, what are the most potential user cases in health AI. Well, this is a impossible question, of course, because AI is, and at least will be, almost everywhere in our health and social care systems. But we ended up with more than 50 most potential user cases, and that was, of course, too much. So we selected 10 of those and started the pilots for those. And as David mentioned, we don't have that much real evidence on the effectiveness of these, but we do have some evidence, real studied evidence as well. For example, we have been working quite a lot with as a simple issue as online voice-to-voice translation between the professional and the patient. And our expectation was that we can cut 30% of the translation costs. And now the preliminary results show that it is not so. We can do much better.
Okay, all right. And anyone on the floor who wants to contribute, please do.
Good morning, everyone. My name is Rui Medeiros. I am what you call a clinical scientist and professor. And also, I would like to say this discussion on AI, I've seen this movie before. In adult times, we had some books were dangerous. After the TV was dangerous, the internet was dangerous, Wi-Fi was dangerous, everything was that. Well, everything that is new, we do not understand it very well, is dangerous. So we have to keep this on mind, and I've seen.
Yes.
I'm okay with that because I grew up on an island without TV, without phone, everything. So I know it's a new world, the Huxley idea. But we should think on this. AI is a tool. We can use it. And if you take a look on the humanity world, it means someone civilized, giving dignity to humans. So if AI is a tool to give dignity or to be civilized, it's okay. We have to deal, it's something new, but I think it's okay. So we have seen this with books, internet, TV, everything was dangerous.
I think it's a human thing, right? That we're afraid of anything new. And you have, there's this spectrum of late adopters, early adopters, and it's always fear when there's something we don't understand. And maybe you spoke, Yuka, about this pilot of the voice translation, right? You said 30%. Did I hear that correctly? That it was, what was the 30% again?
Yeah,
it's
so our assumption when we started this pilot was that we can save 30% of the current translation costs in our welfare counties.
Would be, it would reduce?
It would be reduced 30% of the current translation costs. And now the preliminary results show that the potential is even higher without quality problems there.
I see, okay. And what about the workload? How did it reduce any workload, or is the workload calculation included in the cost reduction?
Yeah, this is basically the workload. So we can save the human translations there, and this is the biggest amount there. But I also have to mention that the professionals, they love it, because when there is a human translation, the interaction is not that good.
Because
the
it
AI
passes from one to...
Yeah, so there are kind of 3 parties, but with AI there are only 2.5.
2.5, okay. Interesting, okay. Has anybody used in the floor 0.5, I don't know, agent? during their clinic? Has anybody used that? Okay, not yet. It's
yeah, before somebody is raising up. So we are not just using the basic online AI tools for the translation, but we are using a health-specific application
translation.
with a CI marked.
It's a fine-tuned model.
Yeah, with the correct vocabulary in it.
It's very cool. Okay. And here, anyone on the floor wants to contribute? Have questions, thoughts? Yes, please. This is an informal conversation. If yes, thank you very much. Well, thank you for doing that.
Thank you. So, thank you and good morning. I'm a medical geneticist, and my biggest problem and being afraid of using AI is the use of biased data to feed LLMs, unintentional, and we also have known examples of purposely trying to bias the results of LLMs, and that can lead to escalating inequalities and of underrepresented individuals or populations. So this is my biggest fear on using LLMs. I use it personally in clinical open evidence. That's the one I use. Thank you.
Maybe here I can ask the panel what you think would be practice that works well in counter-measuring the inherent bias in LLMs in your experience. Any thoughts?
Yeah, I mean, in our institute at the HHI, we like our innovation field includes also explainable AI, and I think there are methods, or like for example, on technical level, how you can try to explain, or also like have the LLM providing references, for example, where the input came from. The study that I mentioned before with the LLMs, that's also like an idea to have like retrieval augmented generation, a RAG approach, to provide the LLM with the actual source of the data. But of course, bias is always a problem, and I think we always need to have that in mind. Also, by using these tools, we need to really be aware of that they can also hallucinate, or I think it's important to know how to use it.
Yes. Any other thoughts from?
I just yesterday read an article from the American scientists, and they wrote that LLM, particularly ChatGPT, was trained on the open basis, and they're using articles that was not proper organized and not included in the publication in the research basis. Yeah. So it means there are a lot of mistakes and errors there. So and that level, so I personally don't recommend to use this in preparing your scientific research and publications. At least you need to double check. Otherwise, there's not proper training for now. So because it's cost a lot, so they use open base, and there are a lot of mistakes there. So that's why.
Do you want to come in, Yuka?
Yeah, of course, this is a real threat, the biased data. But let's also face the facts that even how much quality improvement we are doing for our data, there will be some mistakes in our data. And there are also a lot of other possibilities in the AI that can cause faults. And one of the big questions is here that how much reliability, how much better quality we require from the AI than for example, from the human beings. And actually, we have to learn to human beings and AI work together. And we already have evidence on that if we are doing that the best possible way, that can lead to much better results. But there is also threats in that. If we start trusting the AI too much and lose the human competence for the real decisions.
Thank you. So here maybe I can ask the audience, would you use, so one of the most advanced areas where AI is used is in radiology, right? They have all these machine learning models, neural networks. My question, maybe you can raise your hands, and if you have any thoughts, would you use an AI that tells you this patient has pneumonia without telling you why, based on an X-ray scan? Would you use that kind of AI? Any thoughts? I'm going to repeat my question again. Yes. So, if you had an AI model, yeah, okay, yes, please. Exactly. Exactly. Yeah. Exactly. So I think this is where they were hinting about the explainability. The AI model needs to highlight, this is where, in this X-ray, where I made my decision, my inference, that this is a pneumonia case. And then tell that to the physician, and then the physician can decide. And we have another thought at the back. Yes, please. And another one at the back. I love this.
Okay, sorry. Perhaps oversimplifying it, we need AI to enhance and not to replace, specifically in terms of clinical aspects. I don't think that it's wise, specifically from an ethics standpoint, for an algorithm to replace a clinical practitioner, at least at this point, let's put it this way right now, to replace it, but to enhance their knowledge, their highlights of things that might be missed, because in terms of expertise, we should be aiming for better expertise and not for expertise replacement, especially in areas where we are luckily still able to have healthcare force professionals ready, while if we go to other areas where there's no healthcare professionals, maybe we could discuss about replacing an absent professional with an AI agent or something of a like, because it's better than nothing, we hope. We need the evidence to support that. But in Europe, in a broad term, I would say that we need AI to enhance and not to replace the clinical practitioner, I would say.
The word I often use when using AI and humans is to amplify the human's capacity to work. Yes, please.
Hey, I'm from the same institution as Miguel, ULS São João, right next door. I'm a neuroradiologist in training. I would say that not even my neurosurgeons colleagues would believe me entirely if I would say there's a tumor in someone's head. So this kind of, let's say, skepticism is very usual in medical practice. So the black box problem from AI and machine learning is not only dangerous, I would say, but also it has to be improved in that sense, because even from a human perspective, from my perspective, I believe it's difficult if you have multi-speciality meetings and having to explain step by step what I think to other colleagues. So that kind of explanation needs to be further enhanced.
Thank you. And I heard black box. Thank you. So now, yeah, Eva, please.
I would like to add to that conversation that I think it's important to do user testing again, and
yes.
to also have the human-computer interface and to see how you have to present, or what's the best way to present, for example, the explanation to doctors. There have been studies that showed that there's, as Yuka mentioned, that there's a de-skilling effect, kind of, that doctors don't trust themselves anymore. I mean, this is not what we want from AI, but I think AI could maybe also be complementary to tasks, like where doctors are maybe not that good as AI, for example, and then there are others where they are better. So I think there must be more studies to really understand how we need to present the information, how do we need to present the outcomes, and also how to train doctors or other healthcare professionals with the use of and with the outcome of AI, which we already mentioned before, like the training, education, it's important, but does it really mean that every doctor has to be an AI expert and has to be like has to be able to program AI? I don't think so. I think it just needs studies to really see what's useful in the end, or what's the best way to explain.
Yeah, what's the synergy between the clinicians and AI? Yuka, you want to add to the conversation?
Yeah, from the talk from the audience, I would like to also say that in Finland we are not replacing the professionals, and as mentioned, not yet at least, but we are aiming to replace some of the tasks that the professionals have that everybody hates. I see a lot of professionals here, and I would like to also make a question for the audience.
Go ahead.
How many of you absolutely love typing in the patient notes into those patient record systems in the structured format?
Is there anyone who loves doing that? Raise your hand, please. Oh, okay. Is this silence means yes, or all of you hate it at all? Okay. Yes, exactly.
So this is one of the areas where we are working very much. So we are focusing in these kind of high volume issues with AI at the moment. And we have estimated that in Finland, we are quite bureaucratic country, I have to mention. The professionals, they are spending 45 minutes per day for these kind of routines. 45 minutes of each professional every day for these routines that basically don't benefit anything. And with the AI capturing the notes from the conversation between the professional and the patient, we have been able to reduce this number from 45 to 20 minutes per day.
Thank you. I don't know if you've seen it on LinkedIn. There's this article which says, I want AI to do my laundry and my chores, and I get to do my job. But right now, AI is doing my job, and I still get to do my laundry and chores. You see that? Yeah, so this is the point. And maybe I go back to the black box question, because Igor, maybe here I can ask you about the quality and accessibility of medical data for training and testing AI. So how did it work in Uzbekistan, and what can you share to our colleagues about what worked well in that situation?
So we are starting speaking about digitalization in our country, I think 20 years ago, and still we have paper, paper-based history. It's really difficult to implement nationwide because we are highly centralized country, and we don't have capacity somehow to introduce in the whole country one system each year, which will be help doctors and researchers to receive data for the machine learning or AI, other tools, computer vision, etc. So that's why we are still using, let's say, localized databases. For example, in one project, we need to go to the, this black box with full paper history and took the database made by hands, It took for us at least one year. And then another case, it was, for example, 10,000 X-ray images to make some application in order to recognize whether it's pneumonia or not. And again, it was very hard to receive this data and then make, this application, etc. So we started in this year combining in one system, and the government promised that it will introduce in the end of the year, and now they're reporting the last week almost 24 million population of Uzbekistan already in this system, and now it's everything is digitalized. But in reality, I'm working in the several medical centers, huge one, and still we have, this, and it's more than 45 minutes. I don't know, you are lucky, 45 minutes. It's 3 hours, I think, something like this. And it's very important to have such a database, very important. But we are struggling, thank you.
And we talked about database, thank you. And here, I'm going to pivot to the European health data space, Eva. Maybe you can contribute here how it can help address data fragmentation and low EMR adoption. What have you learned in your experience?
Maybe I can start from providing a German example, like how we have the health data hub in Germany that looks into collecting the electronic health data and then also providing it for research purposes, for example. And I think many European countries have the same. And I think with the European health data space, it's for me as a researcher, it's it would be a great opportunity to get access to high quality and also more heterogeneous data. I think also for the models, they will become more robust in the end if they are trained on more data from different countries. So I think I'm really looking forward to having the European health data space in practice, because in my imagination it would be very beneficial for research, AI research across Europe. And I think it also makes sense to align all the national kind of data hubs with the European Union. I can stop here. I can talk
Imagine
about
millions of data to be researched, right? With their permission. Yeah. With their permission.
Yeah, but this is an important point, because I think it's important to to educate and also make clear, because in the end, the population or the citizens, it's their data, right? So I think they should know that they are in charge of their data, and also they are in charge of whom they will provide access to this data. And in Germany, the electronic health record will be mandatory for everyone in 2026. And right now, more and more people are using it, but it's a very slow uptake, I think, which might be normal when a new, something new is introduced. But I think it's important that, people are educated about, or that there is communication in an understandable way, how to use it, what it is, what purpose it has. And I think in the end, there was a study recently about the openness of people to also provide their data and to give it, to share it, for example, for research purposes. And I think it was about 43% that were willing to do this, and then about 20 were very skeptical about it. And I think to enhance this number, it needs more communication.
Thank you. And that leads to my second to the last question of this panel. Maybe I can ask the panel, what strategies worked well for you in your country in increasing clinician AI literacy and building a culture of augmentation, amplification, and not feeling that they're going to be replaced?
I think that the key issue here is open communication, doing things together. And there was a very good point that we human beings, we are always afraid of new things. And when the things become more familiar, we understand the phenomenon better. See what are the real threats and what are the real benefits, and that's exactly what we need to just keep on doing.
Thank you. Igor, Eva, if you want to contribute.
So I have made research in 2021 about what doctors thinking about AI, and it was skeptical more than 90%. And then in 2024, it's only 45%, so we're slowly decreasing. And I believe that in the future will be no so much skeptical people by using AI, because it's simply in our life. I was last time in Porto in June with the project that I was presented and want to discuss with the doctors from Portugal, and asking what's the main download application in the Uzbekistan, you know. I told them ChatGPT, and then what's the highly downloaded application in Portugal? It's again ChatGPT, and it's similar in all the countries of the world. So we are all using. And then again, we're making researches in the medical schools, medical students and medical faculties using ChatGPT and similar large language models, 95% using them. We need to change, starting from students and medical education. We need to teach them how properly use, because it's not single and very expertise, organized education, and I'm really happy that you will do this for us, prompting engineering, etc. And we're using how we can use. So it could be really dangerous now, and I see the students don't want learn like in the past. They are using just ChatGPT, that's all. It's tragic a bit in my point of view. Thank you.
Especially if it makes up references that do not exist, right? Okay, and maybe Eva, and then I will pass the floor to people, because I would like to ask the floor to people after Eva. What kind of training, I don't know, convincing that clinicians need to help you adopt AI, enhance your AI literacy? And I'll ask that after Eva. Please go ahead.
Yeah, thank you. Yeah, so I think, as I mentioned before, it's important to understand the user needs, and this could be, for example, reached through co-creation workshops, for example, but also an important point, and also part of my research, is to work on standards and evaluation of AI for health, and I think this could also help to give best practices or guidance for developers, but also for clinicians, for other stakeholders, how to, or what they have to consider when applying AI in clinical settings. The focus group AI for Health by the ITU and WHO, that was also mentioned by David in his speech. This is where also the Fraunhofer Heinrich Hertz Institute is involved in from the beginning, and our research institute has a long tradition of standardization. And in health, we contribute to this group, and I'm co-chairing the working group clinical evaluation, and this is exactly what we were trying to do to develop a framework, or that was published through the ITU, and then this framework was applied in a clinical study in Kenya and Tanzania, where colleagues from one of those use cases applied our framework in form of a checklist. So I think checklists or courses, something like that, could be a a way how to, to educate, how to make AI accessible. The WHO ethics group also has developed, based on their framework, an online course for ethics and AI for health. This could be, some examples how to approach this.
Thank you very much. And now I pass the floor to our colleague over there.
Yeah, I'm an internal medicine physician, and I spend most of my days trying to work in the medical education and healthcare professionals education. And my concerns are that we spend too much time planning how we will train people. So while we plan how we will train people, they are already using the materials, they are already using everything without any coaching. And sometimes when it comes to digital health, people tend to think that they know enough. So you please don't come to teach me about my own phone that I use every day. I already know everything. And when we go to the healthcare professionals, I think that we scare them if we say something like, we will teach you how to program, and they will like, are you what? I don't care about that. They don't really want to know many things about, or most professionals, they don't want to know things about black box, blockchain, interoperability standards, or whatsoever. So I think that training needs to be focused on patients. Then we care about. And then we have to make really a connection between the technology and how it will be used for the people, for the patients. And most of the times we don't need to explain really what's behind the technology, but just to make sure that it's safe, easy to use, and that will be not another burden to the workload burden that we already have.
Thank you. Yuka?
Yes, good comment and good discussion. And once again, I think that we have to once again find the right balance. As you have already heard, I'm a big fan of the learning by doing philosophy, but at the same time, we have to keep on going, also educating and re-educating our professionals and patients and things like that. And I give you still one more example from our ecosystem. So we have also started to restructure or replan our education plan for the universities for the applied science, and also for the second degree education, how to include AI aspects into the health professionals' education.
Thank you. So, any other thoughts from the audience? Yes, please. And then yes, please. Oh, I love this. I love how you guys are participative. That's nice.
Hi, good morning. My name is Germano. I'm an anesthesiologist from IPO Porto. And sorry, my phone fell down. I think everyone here agreed that with LLMs or AI, we democratize the knowledge. So it's very easy to get the knowledge, truth or false, we don't know it. And if you think in this case, I think the problem is not health policy, but education policy. So we need, my child with 11 years old and 13 years old, they use ChatGPT and others LLM to know the things that they want. So I think, like the previous spectator speaks, we need to teach how to do prompting correctly. I think that is the point. But another thing that we need to think is people want to be an easy life. And with AI and LLMs,
we have an easy life. Even the child nowadays don't like to read, but like to see movies. They like to hear. In different countries, for instance, Brazil, in WhatsApp, they don't texting, they voicing. So in this case, and there are another thing that I thought that I want to share is it's not true that the statistics analysis that we did in the past in old papers are better, the ones that the new LLMs do it. And everything is faster and everything is correct. So what in this session, I would like to provoke you to think that the problem is not from education level, but it's not from health level, but education level. So we need to show people how to do it, the best way to do it, for to become a best world. Okay?
Thank
that
you.
is my thought.
And on that vein, before I ask the final question, is there anyone saying please and thank you when they use ChatGPT? Please raise your hand. As they say, we listen, we don't judge, right? Okay, so you know about this study that's saying please and thank you actually consumes a lot of energy. So I would suggest, I know that people think, like, okay, I have to be polite to the AI, because when the AI uprises, if I'm rude, I'm the first one to be targeted by AI, right? That's always the thinking. But I'm telling you that I will also be one of the first to die in that AI uprising, because I don't say please and thank you. But yeah, so I suggest for climate reasons not to use AI, please and thank you. Doesn't need that. Okay, and one more thing. Do you know about persona prompts? Persona prompt engineering. Do you know about that? Has anybody heard that? So when you use ChatGPT, you say as a first prompt, act as a someone. Act as a expert medical secretary with 100 years of experience in doing medical records and blah, 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 blah. And then it prompts that. Okay, anyway, I'm getting entertained. Yeah, sorry. Maybe as a last question to close the fireside chat, what one piece of advice would you give other countries starting their AI journey based on your experience? Maybe I can start from Eva this time, if that's okay.
Yeah, so maybe to learn from each other and don't reinvent the wheel.
Thank you. I
Okay.
work in knowledge management, so that's exactly. Oh, sorry, I cut you off. Go ahead.
No, and also to engage like multi-stakeholder, like having like events like this to bringing together different stakeholders from many countries. I think that would be my advice.
Knowledge exchange. Nice. Igor, Yuka?
The medicine is a highly standardized profession, and it will be replaced anyway in the future. I believe. But for now, and the next several years, I would like to recommend to integrate in the physician of element of AI that the patient is the first place, and that we take care not only about the disease, but also about patient data, and that we'll start about the medical AI ethic integrating this one and starting philosophically thinking and including education and this point of view starting from early age, and that will be really good one thing. I believe in this one. Thank you.
Thank you.
I think my main point would be that just start bravely using the AI and utilizing it. Don't be afraid. They are not going to replace us. They are not going to take over us, not at least yet.
Not yet.
And at the same time, monitor and manage the risks. There are risks, but they are quite manageable.
Thank you. Okay, I think we have two more. We can take two more questions, and I give the gentleman the floor, please.
Okay, thank you. Just a remark. I'm not a medical doctor. I have a degree in engineering for more than 40 years, and I have attended dozens of e-health information systems meetings. And what I found amazing in this session today is that for the first time, health professionals are leading the discussion and the reflection about subject, which is quite new. My colleagues from IT were very quiet during this session, which I find very good, and it was doctors and nurses that are discussing AI. So this is a remark, not really a question, but for me, it's very meaningful, and I want to share it with you.
Thank you. I'm glad we have a psychologically safe environment with people saying please and thank you to ChatGPT. Yes. Anyone else? The last remark of the day, Dr. Oliveira, please.
Hi. When we talk about AI in such heterogeneous audience, probably we are, each one of us is thinking about different things. The majority of human population that has access to AI, it is still a part of humanity that has access to this type of technology. Probably it is using a technology that is mostly developed by an industry that might not have hopefully have, but might not have the same alignment of the interests of humanity. And the majority of children, of adolescents, young people, and all other people that use this technology are interfacing with a technology that might evolve and might be disruptive, more disruptive of the social fabric than social media was and still be. There are lots of challenges, not trying to be more careful with the words, not, I prefer to use the challenges, and a huge amount of opportunities for the use of AI. But the potential disruptive in social fabric is still there. And more than that, in the perspective of humans have about the world, we might start to live quite fast on a dystopic era. What are your thoughts about that? Are we already prepared as society, as governments, and some of us has responsibility in the management of data from patients, from citizens? Are our infrastructures ready to accommodate AI tools? And what are your, this is one perspective, and another perspective is the society ready to, are we ready as a society to take advantage of all of these opportunities? Training is a key issue for when we talk about healthcare. Training is a key issue for all the professionals, especially the ones that have an interface, directly interface with patients. We start to receive patients that know more about their diseases than the physicians that are attending those patients. And this is becoming an opportunity, but also a problem to deal with.
Anyone would like to respond to
Yeah,
that?
maybe I will start. As I totally agree, because it's like a nuclear weapon, you know. We are treat the people with the nuclear. Yes, but it's very, very high dangerous for them. And also, for example, lethal weapons using by AI. It's also, we as a doctors, as a physicians, as a nurses, we are last bastion. Like I'm fan of the Game of Thrones. We are night watchers. We need to fight. We need to make Isaac Asimov rules for AI, not free, but for is ethic. So that's why I fully agree. So we need to organize society, medical, medicine workers for the AI, and against the AI is a potential dangers for the human being. So this is the huge, huge issue actually, and we need more discussion and public consultation on it. So thank you so much.
Thank you. Eva, Yuka? No?
So yeah, I agree that AI has a huge impact on society as a whole, and yeah, I agree also that it needs like safeguards to guarantee that that we know what we're doing, like when we're using AI, especially for the younger generations. So yeah.
Yeah, this comes to what we started about the opportunities and threats once again. So I think that the main issue here is that this is a huge change for our society as a whole, and we have to take care that we as a human beings are on the driver's seat. And also when we are at the driver's seat, we don't overspeed, even though we have cars or technology, AI, that could very easily allow us to overspeed. And this is how we have to manage the change over here. Then I still want to say one word about the data infrastructure, because your question, are our data structures, infrastructures ready for the AI? And in Finland, we like to think, at least ourselves, that we are superpower of the health AI or health data. We have gathered data already for decades, and we have another national level coverage of the data in our registers, and we are not ready. This challenge is our infrastructure, data infrastructure, in a huge way, and there is a lot of work that we have to do.
All right. So with Yuka's remarks, I close the fireside chat, extinguishing the fire, with two remarks. First is please don't say please and thank you to ChatGPT, and that second is that I beg you, for the climate, it's already consuming a lot of energy. And the second is that AI should be used to responsibly amplify human capacities and not replace us. Thank you very much for your active participation, and have a nice rest of the conference.
Thank you all. Let's make a change to the program and bring it forth. The next presentation is AI as a tool to improve quality of care and ensure better patient safety, challenge and opportunities. It is my pleasure to invite Professor Dr. Joana Seringa from Nova School of Public Health to take the floor.
Working? Yeah. Hello, good morning, dear colleagues. It's a great pleasure to be here today and to participate in this regional dialogue on AI for health. I would like to address a special thank you to João Breda for inviting me and trusting me for this session. We have already just talked about country experiences with AI. We talked about adoption barriers and how the different topics are being handled. Now we are going to discuss how AI can actually be used to improve quality of care and patient safety. Right. Starting with WHO vision, that is very clear for quality of care. A world in where no one is harmed in healthcare delivery, where the safe is care and respectful for everyone, every time, everywhere. To achieve this, we have to focus on 7 dimensions. Safe care, avoiding harm to patients. Effective care that is provided evidence-based. People-centered care that is respectful of individual preferences, needs and values. Timely care that reduces delays. Equitable, same quality of care, the highest, to everyone, regardless of the background. Efficient, maximizing the benefits of the limited resources we have available. Avoiding waste, and integrated, coordinated care across all levels and throughout life. However, even though we have such a clear vision and dimensions to achieve it, we still face a huge burden of unsafe care globally. 1 in 10 patients is harmed during healthcare delivery. More than 3 million people die every year due to unsafe care. The medication errors cost reaches $42 billion annually. And most critically, more than half of this harm is preventable. These are not just statistics. We are talking about human cost. We are talking about patients, families, communities that trust in us, in their healthcare systems, to improve their quality of life. And yet, we are failing them. My question is, how can AI support us to change this picture? To actually help us to make a better healthcare system, a safer one. Let's see some applications of AI in one of the 7 dimensions we just talked about. Starting with safe care, where AI is already demonstrating a significant impact. Consider sepsis, a life-threatening condition. AI surveillance systems have reduced average hospital stays from 13 days to 10 days and decreased in-hospital mortality by a relative 58%. The UK will launch in November the world's first AI early warning system. The system is designed to detect patterns in data where there are potential issues for safety. They are going to launch it first in maternities before expanding to other areas. But these are just 2 examples. AI can also help us identifying possible drug interactions, and with that, allow us to make prescriptions safer. Or at the surgical field, with surgical planning and intraoperative complication preventions. For effective care, AI is improving diagnostic accuracy and treatment precision. The NHS results have achieved impressive 45% improvement in diagnostic accuracy, 12% in diagnostic efficiency for lung cancer care. This means detecting cancer in the early stages while treatment is more effective. AI can also support us with clinical decision-making by providing us with evidence-based recommendations. Precision medicine by matching the optimal treatment with the specific characteristics of each individual, or for disease surveillance for public health intervention. People-centered care. We are talking about people-centered care for ages. We have been discussing strategies to actually make it happen. Yet, we are still far away from actually achieve it. Maybe AI can help us to make a step forward in that direction. Europa Uomo initiative is already using a chatbot, a virtual assistant, to answer questions about prostate cancer in any language, 24/7, based on European guidelines. This helps health literacy to actually increase the engagement of patients with their health care, to improve shared decision making. AI can also support us for culturally adapted care that respects individual values and contexts. Timely care, that is about eliminating waiting times. In Finland, AI optimization at a healthcare center reduced average service cost by 14% in just 5 months of application of AI model to improve patient flow and triage systems. AI can optimize the scheduling of surgeries, consultations, considering both the resources that are available and the priority of each patient, specific on their conditions. Or for automated triage systems to make assessments faster and prioritize care allocation. Also, automated referral systems to improve patient flow throughout the health services. Equitable care, ensuring that everyone receives high quality of care. AI can analyze geographic and demographic analysis to identify cover gaps, and with that, to allow us to better allocate resources to the populations that actually need them the most. Or accessible interfaces and multilingual systems that reduce disparities. As we talked about, European Health Data Space is also going to support this. By having access to data across Europe, we can develop algorithms that are more robust and then that can actually reduce the bias that we already have in our systems instead of perpetuating them. That is one of our afraid with AI. In Portugal, we are already testing AI solutions for efficient care. Real-time emergency department capacity management systems, automated report filling with activity data, or even clinical documentation using natural language processing, as the colleague in Finland talked about. And let me share with you that our professionals are already loving these solutions, because now they have more time with quality to be with their patients, to actually look again in the eyes of their patients instead of being hidden behind a computer. So this is not just about more efficient care. Asking to Tarvon's question about the biggest promise, I think the biggest promise is this: to actually humanize healthcare delivery. And finally, integrated care. AI can help us to harmonize data coming from different sources, to actually have a view of the whole patient records, and with that, make better clinical decisions. For care coordination, to help us to identify patients that need follow-up, so we can intervene earlier and they don't come readmitted to our healthcare facilities. It is also especially relevant to coordinate care across multiple stakeholders, especially for patients that have higher complexities, multiple chronic conditions, that is the majority of our population. All of these benefits and the benefits of these applications, we can use them, but first, we also need to overcome the challenges and barriers that we face nowadays. Legacy IT systems that are most often not compatible with AI deployment. Data fragmentation that we still see across healthcare providers with very lack interoperability between healthcare networks. For instance, public sector not communicated with the private sector. Or cybersecurity threats that keep intensifying. In Europe, we have a special complexity with the dual regulatory framework, the AI Act with the medical device regulation, adding an additional layer of complexity with GDPR, where countries have slightly different understandings of its implementation. algorithm bias risks, and digital divide that keep persistent concerns. Training and skill gaps, as we already talked about, are at the foundation for adoption barriers. We don't trust what we don't understand. If there are models that are black boxes, as we said, it's difficult for us to trust, and especially in a sector that is risk-averse, like ours, healthcare, this is especially concerning. The change management need to have all of these in considerations, as well as the liability and accountability concerns that keep unresolved in the case of AI making mistakes. To overcome these challenges and barriers, I suggest that we actually develop national AI healthcare strategies that are aligned with WHO standards and goals for quality of care and patient safety, that we foster collaboration among all the healthcare professionals and all the stakeholders of the system, to invest in interdisciplinary training that combines technical, clinical, and ethical competencies, to ensure user-centered solutions that are built with transparency, explainable AI, and to establish robust frameworks that balance innovation with ethical and regulatory oversight. It is very important that we have this regulation in hand to guarantee that our data is protected and that we are safe, let's call it this way. But it is also very important that we keep fostering innovation, that we have cultures of innovation and continuous improvement in our healthcare systems, in our infrastructure. The implementation of responsible AI depends on all of us. Policymakers that can develop AI regulations, ensuring patient safety while enabling this innovation, or healthcare professionals that are at the right position to champion user-centered design and provide clinical expertise. Tech developers that should co-create these solutions with healthcare professionals, with patients, the society, to make sure that the solutions answer the needs of the healthcare systems. And patients and citizens that should advocate for explainable AI and for equitable access to AI-enhanced care. Researchers that have in their hands the responsibility to evaluate the impact of AI in quality and patient safety outcomes. This roadmap that I bring here is combining the different topics that we already talked about. Starting with the foundation, we need the right infrastructure that is ready to deploy these solutions. We need training and create capacity in our health workforce, but in the society in general. Then we can move to validation, to test AI solutions across administrative and clinical settings, and evaluate their impact on the outcomes. Once proven, the focus should shift to growth, scaling successful AI solutions, system-wide, nationally, to create innovation hubs where we keep continuously improving these models. And at the end, we should have the commitment to actually share our knowledge, the best practices. As we said before, we don't need to only learn from our mistakes. We can learn from the mistakes that are being made and learn together in an open innovation perspective and culture. As I finish my presentation, I would like to share with you that I actually and truly believe that we are in a moment of opportunity. AI is actually a powerful tool that can help us have the healthcare system that we envision. A system that is safer, more equitable, more efficient, people-centered, but technology alone is not enough. Real progress depends on all of us. Our vision, our collaboration, our commitment. The solution is in our hands. Thank you. I look forward to your questions. Yes, please.
Thank you for your presentation. It was very interesting. How do you see a role for Europe or the WHO to help with this establishing of the infrastructure that we need for AI?
Well, that's a good question. The infrastructure that we need, I mean, we have these systems that most of them are outdated or are not really built with this perspective of having AI. So there is, of course, an investment in terms of funding that is needed to actually have this infrastructure. And we know that not all the European countries have the same capacity to actually improve their infrastructure, but it is something that we need to actually start and to do it. So when we want to apply these solutions, they are integrated in the workflow. We don't want another island of information that we need to open another window to use AI or something like that. We want it to actually be integrated in a way that we basically don't understand that we are using it. It's so natural that is not an administrative burden, another burden for our healthcare professionals, but that actually support them to do their best job.
Thank you for your excellent presentation, and I agree on most of the ideas. I would like to ask and ask your opinion on this. AI, I agree, is a tool for healthcare management and systems, but on your opinion, where is the limit behind or the frontier on AI being a tool for healthcare and being to be the running machine of healthcare? Where you have any idea, any clue on that? It's something.
Yeah, well, that's a very interesting discussion because actually, as I said, and I truly believe that the promise of AI is in actually supporting us to humanize healthcare. But for that, my biggest fear, on the other hand, is that we forget that AI is really a tool and we need to keep this human interaction. So we need to, and I'm one of the persons that say, please, and talk in this, like this with AI, not because I'm afraid that it will take over or something like that, but because even when interacting with these tools, we know that they are not normal tools. We don't discuss about Excel with our colleagues in a dinner, right? But we are talking about AI during dinners. So it's a tool, but it's a very, very powerful tool. We know that. And this frontier, we need to keep in mind and have the regulations, of course, that will support us to do it. So we don't forget that AI is not our best friend. We need other human beings to keep this humanization of our society. But it's a very tiny lie that I think that only with regulation and proper training where we understand the benefits but also the risks of AI, so we are not resistant to applying AI, but we are not also over-reliant of AI. And I think these are the two main issues we should think about for this specific title line. Thank you.
Thank you for the presentation. Once again, two quick questions, I hope. One of them regarding the already known publication bias. From the search of the literature and the evidence-based case that you're mentioning, to what extent do you feel that some of the publications that we're seeing are just the tip of the iceberg of the failed experiments that did not go well and did not, because of that, go published? And the other one is the difficulty in terms of replication of initiatives. Because sometimes, especially when we're talking about models in a broad term, the use of a model, if it's not like a worldwide use, how much of the replicability of an initiative can be endangered by the fact that the model itself is not transferable to another setting, especially in terms of languages and so on, or proprietary reasons.
Thank you. I will start with the second, and I will repeat. Will ask you to repeat the first one. Sorry, but starting with the second, all the algorithms that we have, they need to be validated in the specific context where we are going to apply it. We can have the perfect model to predict heart failure hospitalizations that was developed in Spain with the whole population of Spain. But when we want to incorporate it in the Portuguese healthcare system, we should validate again these systems. Because even in Portugal, algorithm that is workingly and that was trained in a specific limited population, there are differences in the population that probably will make a change in the performance of that algorithm. So we need always to validate these solutions in the context where we are going to apply before making the deployment of these solutions. That is, for sure, the generability term that we use. Of course, solutions can be transferable, but always with this validation in mind to the specific context.
For the first, it was, thank you. First of all, for the first question, again, is the idea of publication bias on what works when what doesn't get noticed, so to say. So we tend to not learn from our mistakes in a way. And so on your perspective, what role is there also for different member states in line with one of the topics that was mentioned in the session before is how can we share not only what is going well, but what is not going so well that could eventually be a learning opportunity for other teams and professionals in a way.
Yeah, thank you for your question. Well, we need more meetings together. We need to discuss together. We need to publish. I mean, for instance, these solutions that we are testing, we are preparing publications to actually show what didn't work well. Maybe we were not prepared for this or that. We need to have project manager specific for each pilot or something like that. We need to share the best practices, yes, but also the things that doesn't go as well, but we need to publish it, and we need to have more meetings all together where we can share our experiences and learn from each other. It's the only way. Thanks. Any more questions? Okay. Okay, so thank you very much, and we can keep the discussion. Thank you.
Thank you, Dr. Joana Seringa. And now we move to the next panel discussion. This panel will be moderated by Professor Dr. Azra Ismail, Assistant Professor, Biomedical Informatics and Global Health in Atlanta. The speakers for this session are Dr. Rita Sá Machado, Director General of Health, Dr. Katia Pinto, Head of Global Digital Health and International Affairs, Shared Service of Minister of Health, and Professor Dr. Mário Santos from ULS Sant Antonio.
I just want to confirm we have all the panelists here, because I know we were waiting for Dr. Rita. Okay, that's here. Okay, so we have everyone here. Perfect. All right. Wonderful. Thank you, everyone. And thank you for inviting me to moderate the panel today. So today we'll be talking about key factors influencing the implementation of AI in the healthcare system in Portugal. So we've had some great conversations so far, and here on the panel with me are some experts in how these systems are being used today, some potential experiences that they've had, some challenges that they'll share with us. So just before we get started, we can maybe do a quick round of introductions. So if you could share your name, your organization, and maybe like a short sentence on your role.
Can I start? Good morning. My name is Mario Santos. I'm a cardiologist. I'm a clinician most of my time. I'm part of the digital health lab in my hospital, Hospital Sant Antonio, and I'm also directing the research department of the hospital. I've been involved in several digital research projects, so I think that's why I'm here.
Yes, okay. So I'm Rita Zamachado. I'm the Director General of Health, but I'm a physician, a public health physician by training. And probably I'm here because also DGS has a numerous of not only related to healthcare quality norms and standards, but especially we had also some examples to share with you regarding AI here on healthcare. So yeah.
Hello everyone, good morning. My name is Katia Pinto. I'm MD and specialized in public health, and I'm currently the head for global digital health in the shared services in the Ministry of Health. Our work, as you know, encompasses everything that has to do with technology and digital health, and currently I am very much focused on international projects and the building up of the European health data space.
Wonderful. So great to have you all here, and it's really interesting to have this conversation here in Portugal, knowing that Portugal has been at the forefront of some of these efforts, really looking at how AI can help strengthen health systems, and really, it's wonderful to hear from your perspectives. My first question is for Dr. Hita. So DGS in particular has been central in setting clinical and organizational standards across Portugal's health system. How are you ensuring that these standards continue to evolve and keep pace with advances in AI and making sure there's safe and effective adoption?
I have to say, and to be really polite, is we are actively working on it. I'm saying that because especially 2 years ago when I started the role that I'm doing, we started to develop a new model of norms and standards to design the new norms and standards of the country. And we are in the forefront of actually presenting it in the couple of months. But regarding this new model of norms and standards, one of the pillars that we have included is the integration of digital health and AI, because we see, of course, its importance to what every single person does and health professional within our daily activities. And every time we actually introduce or we review a standard or we design a new standard, first of all, we consider the transparency of algorithms and also the decision processes, the validation and safety of some of the tools to the real world conditions, and also if it's aligned, of course, with international standards. So for us, it's really the focus on how AI can improve quality of care, because exactly that's what we do, and also to improve the patient outcomes and also equity across the health system.
Thank you for sharing that. It's great to hear about the ongoing efforts in this area, and I'm sure we'll hopefully have some open conversation on how others are tackling this as well. Dr. Kati, similar question. You're also doing work in this area. How is SPMS helping maximize opportunities for safe, citizen-centered AI in healthcare?
Yes, at SPMS we are very concerned with making sure that digital transformation becomes more and more person-centric. This concern is not only, we are not singular in it. Portugal is not the only country that is concerned with this. And so we are deeply involved in the last years at the EU level in building up this regulation called the European Health Data Space that will for the first time regulate data and digital health together across the EU. So by building up this regulation, we will ensure that citizens really have portable health data that they can use, whether that data is collected in the public sector or is collected in the private sector. Our work here, it's a two-way or two-dimension work. On the one hand, we are deeply involved at the EU level in the last years, or we were deeply involved in the discussions in the EU Council to make sure that we have a data governance framework that really benefits citizens and is able to improve health. On the other hand, we are working under the technical frameworks of the European Union, namely the e-health network, in building this infrastructure that will allow hospitals and pharmacies across the EU to communicate data between them, and that will also allow citizens to have their data as soon as they leave a health institution.
That's really interesting to see the focus on citizens in particular, and how you can create more ownership around your data and more transparency there. From a clinical adoption perspective, it would be great to hear from you, Dr. Mayo, around like what do you believe are the governance needs for AI in healthcare?
I think that's a critical question, and I don't know if there's a one-size-fits-all governance model for AI, or if we should think about a specific governance model for AI and separate the current governance models for the other digital projects. Because every institution has their own history, idiosyncrasies, and all of that. What I can share is our experience with the Digital Health Lab from the last years at Hospital Santo Antonio. The centralization really matters, more than I was anticipating 3 or 4 years ago. Centralizing enhances the efficiency of the whole process of implementing these initiatives within the hospital, because we really need to be humble to recognize that our IT teams are understaffed, so our critical intelligence to make these projects run within the hospital are few in the institutions, and are overwhelmed with the projects that come from everywhere, from every department. So centralizing, you gain a lot of efficiency on the approval process, the procurement process, for example, with the different companies that come to us to test their products. You learn from what is happening in a department, and sometimes you apply on the other departments. You try to avoid the duplication. In a big institution, it may sound awkward, but sometimes you find that the anesthesiology department is testing the same solution in a different phase that the cardiology department is trying to use. So centralize avoids that duplication, and it really mattered in our governance model when we started doing that. Of course, that centralization is not by itself virtuous. I think there are two features that we combined, and I think it makes sense. The proximity with the people who run the hospital, the board, who make the decisions, who have the strategy for the institution. So having someone from the board in this centralized committee is important, because the communication should be fast and timely, and including in this body the end users, the clinicians. That's very important. So you grasp all the spectrum of the institution, you have the ability to centralize, to regulate, to monitor how the projects are doing. Because sometimes the project is great, the clinicians want to try it, and 6 months after we see that it won't work, and sometimes if you have someone from outside the project, it's very useful. So yeah, the centralizing, having the board near to the centralized committee and with the clinicians since the beginning of the process, I think it's a governance model that works.
There's some interesting themes that we're seeing across panels. So this discussion around the burden across the healthcare administration as well as on clinicians has been an important point that's been brought up. This need to learn across the board, whether that's across teams, across other researchers, stakeholders, is also something that we're seeing, and of course trying to incorporate the end users in the process. Kati, you mentioned kind of the bottom-up perspective of like citizen-driven perspectives and ownership. What about the top-down? How does the governance process work in your institution?
Yes, there's also a top-down approach to data and digital health and especially AI. But when talking about AI implementation and building up the infrastructure to actually be able to scale up from pilots that we can describe everywhere now in every health institution to national solutions that can actually show impact in improving population health indicators, we need to talk about the foundations. And currently we are at a key moment, at a pivotal point at the EU level where we just have a regulation that was published in March this year, that it's the European Health Data Space regulation that I was talking about. And I don't resist to talk about here that actually the first ever meeting that was held between member states in January 2020 to build up what would be the European Health Data Space was held in Lisbon at SPMS, where we first organized a workshop that was called at the time Towards the European Health Data Space. So it's wonderful for us here in Portugal to see that 5 years after that, we have a regulation that it's transformative regarding data governance, cross-border data governance. Why is this so important? Because as we all already know, data interoperability does not happen by chance. Currently, even AI deployment faces challenges that have to do with commercial silos, organizational silos, institutional silos, where data is simply locked. At the same time, we cannot build national silos. We cannot identify our own national standards and connections between our health institutions. We need to make sure that our systems can connect with private vendor systems and that our citizens, whenever they cross border, they can have their data available. At the same time, we need to scale up population health management. We need to make sure that we stop sharing data using Excel files and that we can actually have real-time surveillance. We can modernize public health surveillance systems using digital data that it's available in real time. So this moment where we are in the upcoming 5 years implement this European health data space. And what is the European health data space? It's where it is. We want all to get in it. So this European health data space is a governance model that creates a board at the EU level and that establish rights, duties, and responsibilities for member states that we all agree upon, and also for the private sector to operate at the EU level. This will build interoperability by design in every new health technology application that will be built. And so having this strong focus on bringing, on making available at the national level based on international standards, so future-proof infrastructure and interoperability standards, and build up the data ecosystem for AI, it's a big priority for us at the shared services in the Ministry of Health, while we are strengthening our digital data and digital health governance model to make sure that we can implement a national digital health authority, but also a health data access body that will organize and coordinate all the developments regarding data and AI in the future.
And that sounds like a really important and fantastic effort. So congratulations on pushing that forward. Dr. Rita, it would be lovely to hear from you as well. So, as these AI systems are becoming common as part of hospitals and primary care, what are some of the approaches that DGS is using to monitor and understand the impacts of these systems?
Yes. So first of all, I think one of the key points is Katya just mentioned, that they are building the infrastructure at the national level. But of course, while the infrastructure is being built, we need to keep the boat going. So of course, this experience is coming from every single hospital and every single primary care or every single public health unit of the country. We have some examples that are flourishing. And of course, DGS is also an example of those examples that come, and we have, especially on public health matters, because this is what we do. And I would say that we have a key purpose of putting AI into the role, especially for epidemiological surveillance and of course for outbreak detection and also for emergency response. And on this, we have, of course, started some good, I believe, examples, because before we put out there to monitor, we also do our own homework, at home, to make sure that we are developing some key points. So one of the things is we have been collaborating, and SPMS is one of our, of course, partners in crime, but especially we know that this knowledge and also the competencies and capabilities also come from academia and from technological partners, and that's why they are also partners of DGS. So we collaborate with all of them to make sure that we test tools that are secure, they are ethical, and especially they are also robust that we can use. And that's why sometimes things take a little bit more time that we want them to appear. Let me share possibly 2 examples. One of them, it's our main example, and what we usually come here is that we are using currently language models to code the causes of death. And for us, it's quite important because not only it improves accuracy and also timeliness of what we do. For the first time, we are concluding, the coding of the causes of death with just 1 year. And you may seem that this is, something normal, but it's not. It usually would take us 2 years to code every single cause of death in the country. And currently, we are finalizing with INE, so our National Statistics Office, we are finalizing with just 1 year difference. So this is a major achievement, and I have to say that AI is a powerful tool that has been helping us. Of course, with the new ICD, the machine is, of course, already learning on how to code. And here we are also collaborating and working with WHO in that regard. But this is a good, I believe, example of something that was created and to be used at the national shores and have, again, impact on the way we plan not only the health services, but especially how we plan health. Another example, it's how we are, and this is currently in development for our national surveillance system. We are doing our, what we call CNAV 3.0. And I'm saying this because Katya was the mother of CNAV 1.0. I was the mother of CNAV 2.0. So now it will come the CNAV 3.0. So this new surveillance system, it will actually include AI tools, not only to make us a little bit more aware and how the determinants of specific diseases will showcase a little bit more on the determinants component, but we'll also gather some data from what is already there and avoid the duplication that we are always facing within the healthcare system. And Mario was just highlighting that sometimes we need, we have scarce resources. The health professionals, they need to focus on the patients or on the people that they want to maintain healthy. So we really need to avoid duplication. So we are using and we are going to test AI specifically to come and to, for example, we will have the first notification of notifiable diseases created by an AI tool on base of what is already written by the clinical team on that specific. So I think every single, I will say, a physician here in the room, because physicians are the one that notify, and also the lab professionals. So I think they will be happy to hear that we are probably going to speed up a little bit of this process. And of course, not only this helps the teams on the ground, they will of course be key to public health teams. They need to act quite, on the minute for those specific diseases. They will act faster. So for us, it's quite important that we are developing this. So I just wanted to highlight some of these tests that we are doing, that then they help us to monitor on the basis of course, clinical audits, and not only to make sure that we are, of course, strengthening health intelligence, preparedness, and response.
Wonderful. These are really interesting examples of how you can use these tools in very, very clever ways to support public health surveillance and improvements in public health safety. And it links back to the previous talk as well very nicely. So thank you for sharing that. Dr. Mario, from your perspective, what are the kinds of AI tools you believe are going to be most helpful in improving hospital workflows? And how is ULS Santo Antonio supporting staff in implementing these kinds of innovations?
Regarding the first question, of course that as many other healthcare institutions, we're already using AI in the pre-assessment of images in the radiologist departments. We have some projects with AI collecting structured data from the electronic health record. But as a clinician, if you ask me what would be the most transformative AI dream to a clinician, would be the AI assistant in the health, electronic health record. So I did some training in the US more than 10 years ago, and I was really impressed by the time that the US colleagues put on the clinical notes, because they are reimbursed from the clinical notes, all the legal issues. And so I spent more time with the clinical notes than with the patient, and it was amazed. I was amazed back then. And now when I talk with them using the Epic AI assistant, I'm really jealous. And I think it would be my first, second, third, fourth priorities in my daily clinical life. Having an AI assistant that could help on the clinical notes, on the clinical orders, on the setting up the next appointment for the patient, doing all the work that we still do, and it takes a lot of time. And I think it is possible, it is happening in the other side of the Atlantic Ocean. So every night I dream about AI assistants. It would transform my life and the life of the patients, because we would have more time to spend with the patients and doing high value work that we can do, but we don't have time to do. I think that would be my priority. Of course, I think the second part of your question, the implementation in the hospitals, in the overall healthcare, as someone told in the last session, AI is a powerful tool, but it's still a tool. So I think we should do the exercise of, for example, the digital, why the healthcare institutions failed the digitalization process in the last 20 years when we compare ourselves with other sectors of the economy, like banking, retail, everything. Because some of those obstacles will be the same for the AI. And I think the culture of the institutions, the training of the professionals, and something that is very difficult to explain to non-healthcare professionals that are developing these tools is to communicate the complexity of medicine. I think it's very difficult from someone that didn't have the experience to treat very complex patients in multi-professional settings with evidence, with applying evidence to that concrete patient. It's very difficult when we talk with the companies and with the engineers to express and to communicate that complexity. And I think that was one of the major causes of the failure of digitalization. We were not able to acknowledge the degree of complexity of our daily work, and so the solutions that were coming to us were not fitted to our workflow. And if the clinician don't feel that is helping his job and his patient, it won't use it. So I think the AI movement must learn the lessons from the recent past on the failure of digitalization process.
Thank you for sharing those insights, and I agree with you. Taking a historical perspective on lessons learned from previous efforts to digitize is really important. And I'll actually add here, coming from the US, I think this is an opportunity for Europe to rethink how to do this better. In the US, there is something that doctors call pajama time, because after they're done with their caregiving, they have to sit at home in their pajamas and write up the notes. So there's a reason why all of these documentation tools have gotten so much traction there. It is a problem, but maybe there are other alternatives.
We suffer as well, we suffer as well here.
Yeah, so I imagine there's a lot of possibilities there, but thank you for sharing that. And then Dr. Katia, what are some national flagship initiatives or pilot projects that you know of that are underway that illustrate the benefits of AI for healthcare professionals and patients here in Portugal?
Yes, regarding implementing AI, we have a twofold approach, and just as Yuka was saying, this is a shared role between governments, private sector, and also healthcare institutions. And we are looking at AI in a twofold way, as I was telling you. From one hand, we are responsible for procuring AI in the market. And this is a big deal currently. How healthcare institutions and governments can be sure they are buying trustworthy AI in the market. So this is one area that we are putting our focus on, and also collaborating at the EU level now under the AI Act to be sure that we as governments, as responsible for the National Health Service, will know how to procure and deploy trustworthy AI-based solutions in our National Health Service. On the other hand, we need to understand what are the challenges that we will face that we will have when we will be scaling up local initiatives and pilots that already proved some degree of value in a specific institution. And here we have, I would say, around 10 different projects that we are investing currently to make sure that we understand what are the safeguards that we need to have in place to safely deploy AI in our healthcare system. I could highlight a few, but as we are here today, I will highlight some of them that I think are foundational and are related to cancer care. One of them is the European Cancer Image Federation that we are building currently under the UCAIM project. Perhaps some of you are also working in this project, but as you know, when we are talking about image data and sharing image data, we still have some technological challenges to overcome to make sure that we can really apply computer vision and other AI tools to improve our ability to use image data, to improve cancer diagnosis and screening. And currently, we are working at the EU level to make sure that we have a reliable volume base of images, that it's shareable between our countries, not only for the high prevalent or high incident conditions, but also for the more rare forms of cancer, that we are able to have a reliable number of images that will allow us to develop tools that will actually work in most of the settings that we will be able to apply them to. So this is a very relevant initiative that we are currently involved on under the EU Beats Cancer Plan program, that it's, as you know, one of the priorities under the European Union health policy. On the other hand, we are also involved in local initiatives. We need to understand what problems hospitals face when using AI. One of the most relevant ones that we are just on the verge of starting a scale-up is the Detect NHS 24. So this is an AI tool that uses mobile phones that capture pictures of skin lesions, so it's related to skin cancer prevention, and that we are using to make sure we can improve the accuracy of our skin cancer screening. These two initiatives are two that we are currently investing on, because on the one hand, one of them, it's an example how we need an infrastructure to scale up AI and to move from pilot projects. On the other hand, we also need to understand how it will actually work at the hospital level. Are our doctors able to really use this tool, as we were saying, to improve their process? How can this be better integrated and have reliable measures of improved outcomes? So these two I would highlight here as we are in our Portuguese Institute of Oncology today.
Oh, that's really some impressive breadth. You're trying to look at more systemic kind of infrastructure needs at the same time as trying to make sure that there are local initiatives that are being supported as well. And hopefully at some point the AI assistant that Mario is looking for can enter the pipeline as well.
I'm sure it will.
We have one more question for Dr. Rita, but just before that, I just wanted to check, will we have time for audience questions later, or are we running out of time for the... How are we doing on time? We can, okay, perfect. So, great. So for Dr. Rita, one question again, kind of on the opportunities for AI, specifically in the public health domain. So what are some thoughts on potential for AI for emergency response and epidemiological surveillance? You kind of referred to this earlier, but if you could share a little more about some of the ways DGS is currently supporting these innovations and any early milestones or early successes in this area.
Thank you. So I think before, when I said these two examples, I think, of course, these are two examples that at least they are successes. Of course, you know, among the two successes, we have 10 failures or more. But what I would like to also share, probably another example, even because for DGS, one of the areas, and I see people also on that area here, it's also the health literacy component. And in this, we have been investing also in a tool that it's mainly a tool that aims to really support citizens to make some decisions that we know that they have benefits, at least on the health sphere. But what is interesting with this tool is we are applying, of course, some advanced text mining and data science techniques to really improve the interactions between the citizens, and also patient engagement and also well-being. So one of the things that it's, at least for me, really key is sometimes within a bot or, you know, somewhere, or an assistant, a virtual assistant, we can look for some information that will have an impact, at least on the public health sphere and for that specific person. But this is just, we are just opening the window of this example of this tool. But this tool will be much more powerful once we have implemented the European Health Data Space. So not only we are discussing, you know, primary use of our own data, but also on the secondary use of data to make sure that, you know, on average, that that population on that specific area, we know by the work and through the work of public health institutions that we know the main problems of and the main diseases of the main priorities, the health priorities of that, you know, area, and on the base of those problems, how we can make some suggestions of and related to the behavior of a subset group. So we are working on this, but I would say that in a couple of more years, we will create layers and complexity of what we are doing. Sometimes we are just testing. So I'll give you these 3 examples, but I will also want to share something that probably it was shared before I was here. But one of the key points that we believe we will also be a success, or we will help in the success of these tools, is also on the capacity building component. Not only the capacity building of, you know, in the case that we are here on the primary healthcare professionals, on the hospitals, on every single person that is working within this tool, but also, and for the reasons that you might imagine, for the population component. So on this capacity building, we believe they are, you know, key. And they are key because many of the questions, at least at DGS, that we receive from press, from, you know, citizens, they can be just quickly respond if people understand, firstly, what we do, and not every single thing that happens in the country related to health is DGS fault. But if they understand what we do, if they understand, you know, the roles, and if they understand how that specific tool works, we know that we might be more, at least, you know, have success in the implementation. So one of the key areas that, at least from our perspective, and with the double burden on improving the healthcare quality, but also to make sure that the population understands, we are also working to make sure that we will improve the capacity building process, and of course with the key actors in the field to do that.
Thank you for sharing that. And yeah, I think this also kind of goes back to some of the concerns that were raised earlier around training and educational initiatives and capacity building and so forth. I do want to give the audience a chance to ask questions. Do we have any questions from the audience?
It's almost lunchtime.
Yeah, I don't want to keep people on too long. If not, we can have like closing statements and wrap it up. Any questions? Okay, I think people are hungry. So just to kind of close things out, in one sentence, what is the single most important action Portugal must take in the next 12 months to ensure that AI in health delivers real value to both patients and professionals? And we'll start with you, Maria.
I think I already answered that question. I would also add, because this meeting is being done on a hospital that is a leader on clinical research within our healthcare system. I would like to state that I think the responsibility of the academic institutions is also to perform research on the AI tools, because it's very meaningful both for patients and for the professionals, and we will help the uptake of these technological tools if we show within our community that those tools are working and are helping patients. I think it would be also a responsibility of our institutions.
Thank you for sharing that. Yeah, we'll just go down there.
One key point is also to make sure that we have the established networks, to make sure that we connect all the dots from, of course, the development and through the implementation. And sometimes we, in the country, sometimes we go to the same academic partner, the same technological partner, because we are used to work with them. And if we develop a stronger network among these three at least endpoints, I believe this could potentiate more knowledge and specifically have a better impact on population health.
Yes, I think I will need to go back to data and getting data governance or putting data governance as serious as we can, and ensuring that we look at it as a health service in its own right, because it was already a very relevant domain to take into account in healthcare service provision, in public health, but now it's getting even more serious. AI will not be possible without a serious outlook and a responsible governance model regarding data governance. So that would be my sentence.
Thank you for sharing that. And of course, this is a great venue to continue those conversations and build those networks and hopefully try to proactively work towards creating stronger futures for AI. With that, we reach the end of the panel. Thank you so much, all the panelists.
We'll now have a break for lunch. Good afternoon. The first session of the afternoon is on AI, legislation and patient rights in the whole Europe and the EU. It is now my pleasure to invite Professor Dr. Anna van Kolfschoten, lecturer and researcher in health law at the University of Amsterdam, to take the floor.
Thanks a lot for the invitation today. I will be speaking about law, and I know that for many of you in the room that's sometimes a bit scary. I also know that many people, when I tell them I'm a lawyer of a legal background, they fear that I will stop all AI projects or that I will start litigating against doctors. So first, before I start my presentation today, I want to tell you that that is absolutely not the case, and I actually think that it's very good idea to have lawyers in the room from the beginning when we talk about the development and deployment of AI in healthcare systems. And I will tell you today a bit more in the limited time I have about patients' rights protection and how AI legislation in Europe is currently being developed and how that applies to healthcare. So as we've heard already in the morning sessions, AI is rapidly shaping and transforming healthcare all over Europe. We see chatbots, we see diagnostic systems, we see many different types of predictive analytics used in the healthcare sector. And at the same time, we see that patients are directly affected by these AI systems. One example that we've heard before is the safety and quality of care, which can both be benefited by AI but also be harmed by AI. Another issue we might have is the black box nature of certain systems and how that relates to explainability. And another issue we see is, of course, the problems with biased data. So how do we ensure that the data we collected in one hospital can also be helpful to develop an AI system in another hospital? And a final question is, what if something goes wrong? How do we right now allocate liability and accountability? So what I've been looking at in my research for the last years is how does the law protect patients in the age of AI? So first, a bit of background about patients' rights protection in Europe. We're talking about a very broad field here, also because today is an event from the WHO, so we don't only talk about the EU, but about the whole European region. But still, all countries in the European region have a shared basis in international human rights law. And all countries have, to some extent, patients' rights that are based on these human rights. Some of these rights are, as we call, hard law, so enforceable law that you can actually take to court. So, for example, the European Convention of Human Rights is applicable and protects a lot of patients' rights. But also at the same time, we see that there's a lot of soft law regulations going around. So these are more comparable to standards, to ethical guidelines we follow. And also, of course, in the setting of healthcare medical professional guidelines. What we do see is that even though we have quite some shared basis with the patient's rights, and we all acknowledge some kind of medical privacy or medical confidentiality, and also certain standards of informed consent, there's currently no uniform legal framework on patients' rights, not at the EU level, not on the Council of Europe level, and also not on the World Health Organization level. There are some soft law instruments. There's a Declaration on Patients' Rights from the WHO from 1994. And there are, of course, guidelines for medical associations, but there's no enforceable law in this field right now. And another issue is that these frameworks that we do have, so, for example, the guidelines from 1994, are not adapted to the age of AI. And I will give you a few examples later of why that is relevant. So even though we have these patients' rights on paper in most of the member states, they do not always fit the realities of AI, or they are not directly enforceable in a court, which is what we might need if something goes wrong. So here I'll give you a few examples of AI applications that have been developed and what these developments could mean for patients' rights. Maybe it's also good to have a little moment to discuss what exactly we mean when we talk about AI, because this morning I had the feeling that a lot of conversations were about LLMs, so the ChatGPT kind of systems, which is of course the newest introduction in the field of healthcare, and I think also the first AI system that's really broadly used already. But technically, when we talk about AI, we don't only talk about LLM systems, but also about prediction, automation in a broader sense, and more types of machine learning techniques that can, for example, recognize patterns in large sets of data. And when we talk about the LLMs, the chatbots, then that is based on language models, which work a little bit differently. But now I will talk about all of these systems because I think that healthcare has room for implementation of all of these systems, and in different ways they can make the healthcare space better. So on the left you see a recent paper that was published in Nature Medicine, and this is about biases in AI algorithms that were used to diagnose chest X-rays. So that's actually the first concern that we see when we talk about AI in healthcare, is that there are certain biases in the training data which can also lead to systematic exclusion of certain groups. And here you can think about, in this case, the chest radiographs, but we also have examples of cancer detection algorithms, for example, for skin cancer that were mainly trained on people with white skin. And then if you would apply that same algorithm for people with black skin, it wouldn't find the cancer as easily. Another example is not only in the training data, but also the model we design, so what exactly we ask the AI to look for. So, for example, a case in the US from some years ago where they used an algorithm to allocate organs was not based on different patient data, but was used on POST codes, which then is a proxy for other types of discrimination. So we shouldn't only look for biases in the training data, but also in the model and also eventually in the application. So as doctor, who do we prescribe an AI system to? Do we already have this unconscious bias that, for example, older people will not be able to handle AI systems, or how does this work? So these biases are everywhere in the decision chain of using an AI system, which can also impact access to healthcare for certain populations. Another example, which is I think also relevant, if we looked at how many people were raising their hands today about using ChatGPT in the medical profession. I also teach to medical students, and I always ask them who enters patient data into ChatGPT, and all of them do it. And yeah, maybe they're a bit younger, so a bit more honest about it, or they just don't know so well, but I do think that the numbers are actually quite bigger than come from these official surveys. And now there's also more and more evidence that actually people that use ChatGPT either to enter in their own personal medical data, but also health professionals using ChatGPT entering in patient data from their patients, is not as safe as we think. So there's more and more examples of actually data leaking. So an example of this is that some time ago, the logs of people talking with ChatGPT would appear in Google search results. So that's also an issue and a risk for the rights that all patients have to privacy and the standards that we have for medical confidentiality. And the third example relates to what it means as a patient to have access to information. So we say in general, on the basis of human rights, we say that every patient has a right to access to information about their own medical data, but also about, for example, what exactly is entailed in a medical treatment or whether there are alternatives available. And here's also a question, to what extent do patients have a right to know that AI was used in their treatment? Because do we tell patients really everything from the beginning, that we start, for example, to make a first scan, how that exactly works? This at the same time is quite difficult for health professionals because also they cannot exactly explain to themselves how these systems work. But this may also impact the right to information for patients. Related to this is the right to patients to have autonomy, to have informed consent about their treatment. And this also recent example is, can you say no to your doctor that use AI for transcribing medical conversations? So this was a case in Australia where a doctor was using this AI system, and then the patient said, I don't want you to use that AI system because I don't want my data to be in your algorithm. I don't want my data to be used to improve the model. So if you're treating me, then you will have to write by hand. And then the health professional said, well, then I cannot treat you. And I think this is also an important question because it's not about only autonomy of the patient, it's also about professional autonomy that a healthcare professional has. So do you have a right as the doctor to then say, well, I cannot treat you, just find someone else? Or should you in this case say, okay, well, if you don't want that to be part of your treatment, then I will just write by hand this time. And also, I think a follow-up question is, how long can we still do that before these systems are so integrated into healthcare? If you think back about the time that you had to count heartbeats before using tools for that, can you still demand as a patient that a doctor does that manually? So I think these are all questions that also we as a society need to answer, that the law does give some kind of guidance to, because we do have a right to autonomy. Doctors do also have a right to professional autonomy, but what does that mean for this AI situation? Also the last one, and I think this is a question or a patient right that is often thought of when you talk about liability and in general regulation of AI, is this right to effective remedy. So what if something goes wrong? What if there was harm in your treatments because AI was used? There's actually quite some cases on this. This is a case from the US from last year, but also this summer in Europe there were a few cases of people, mainly young people, talking to chatbots that then encourage them to take their own life. And obviously that also leads then to lawsuits. So this is the first one that actually is happening in court right now. So the parents of a teenager that took his own life are suing OpenAI. And there comes the question in how can you actually prove as a patient that there was causality. So there was actually the reason that the person had this harm, or in this case took his own life, was because of the talking with AI. And also follow-up question, how can you prove causality if you don't have insights in how exactly this AI system functions? So this makes it also very difficult for patients to prove that there was some kind of harm that was caused by the AI system. And right now, we have quite a good system in most countries. If you have suffered harm and you have to start a case against a medical professional, you have specialized medical courts for that. You have also the burden of proof is often with the doctor who has all the information and needs to show what happened. But with AI, because there's often not directly a medical professional involved, we don't have all of these systems in place. So that also begs the question, what happens to this right to the patient of effective remedy? And also the other side, if you want AI to be used broadly, you also need to be able to guarantee health professionals that they will not be held liable if AI is used and harm occurs. So this goes both ways as well. And then we have in the EU and in broader European region, we have this very fragmented legal framework. So as you know, healthcare is a very densely regulated field. So there's very little space to experiment already in this field. But then when AI comes in, you see everywhere that everybody's getting a bit confused on where exactly this fits in the legal landscape that we have now and what you can and cannot do. So in the EU, we have a sector-specific framework where you have the medical devices regulation. So basically, if you develop something that is then going to be used in clinical care, you have to have a market permission with all kinds of safeguards. But now, since last year, we also have on top of that an AI Act, which applies in the same way to automatic cars as to medical devices. And we know that it adds an extra layer to this medical devices regulation, but the people who actually have to ensure that everything on the market is safe, they also don't know yet how that interacts with each other. Then we have from the Council of Europe level, we have, of course, a human rights framework, which is very protective of patients' rights. But at the same time, we have an AI convention, which is designed especially for the use of AI and also to protect the rule of law and protect the human rights of people that are affected by AI. But that doesn't refer directly back to the AI Act. So how does that work if you are in a member state that is both an EU member and also Council of Europe member? And then on top of that, we have the WHO, Europe, but also globally, that also have a lot of ethical principles and guiding principles on how we should or should not use AI in our health system, but most of these are non-binding. And then the last layer is, of course, the national layer, because at the same time we heard today with the Fireside talk that also national governments are developing their own strategies and also their own legal frameworks to deal with this AI. So that makes it very difficult also to see where patients are exactly protected in this field and what is the room still to implement AI that both makes our healthcare system better, but also protects the individual patient. And it also means that how much rights you have really depends on where in Europe you live. So I'll take a moment to zoom in on the European Artificial Intelligence Act, because I think that that is now the most comprehensive legal system that we have in Europe. It, of course, only applies to the EU member states, but at the same time, I expect that other members of the European region will adopt maybe similar instruments, or at least will also look into their own AI legislations. So how it roughly works is that the AI Act divides different types of AI systems into different categories. So the higher the risk of this AI system, the stricter the rules are also for these type of AI systems. Then there's a category that's prohibited. So we said as EU, like, we don't want any of these systems to be in Europe at all. An example of that is the social scoring systems that they have, for example, in China. And then there is a whole category that is high risk, which is education, healthcare, employment, these kind of sectors. And then actually the majority is limited risk or no risk. So that applies to the majority of AI systems that you will interact with on a daily basis. Actually has very little rules from the EU, and the only rule is that you have to be notified that you're talking to an AI. So for example, if you call the chatbot of your bank, they will have to let you know you're now talking not to a human, but to an AI. And most health applications are obviously high risk, because there's high risk of something going wrong with either safety or fundamental rights. So that also means that there are stricter rules when we talk about AI deployment in the healthcare sector. And in practice, that means that there is a category of prohibited AI also in the field of healthcare. And it's still not entirely sure what exactly this entails. There's now a guidance document from the European Commission that says, okay, we don't want manipulative AI, and we don't want AI that is specifically on the market to exploit vulnerabilities of people, but we're not exactly sure what they mean by that. So they have a guidance document with some examples, and also one of the examples in there is one of the examples I said before, like a chatbot that is convincing people to commit suicide. That's one of those systems that is exploiting vulnerabilities. But then the question is, of course, did the developer put that on a market with exactly that purpose, or was that an error in the system? So do we prohibit those systems by default, or can we only say after the harm has already occurred, like, okay, actually, in hindsight, this was a prohibited system? So that remains a bit vague, especially for the healthcare sector. And also in this category, there's a lot of healthcare AI actually exempted. For example, the ones that could be used by psychologists that actually sometimes need to deceive people, patients, to reach their results. So that's not part of this already. Then for the high-risk AI group, that is all medical devices and also an exhaustive list of AI applications that are explicitly in the law. And for example, there's one using AI to determine your status for health insurance, but also AI to do triage or AI to use for the ambulance services. So these are explicit uses of AI that have been listed in the law, so already recognized by the European Commission and Parliament before, that would potentially be dangerous for individuals to use. And then also a large part of these systems that are not used directly in the medical field, but more in the well-being or lifestyle field. So for example, these chatbots that are now around a lot to help you with diet advice, to help you with mental health. They are in this low-risk category. So they only need to be transparent about the fact that they do use AI. So what that means for healthcare is that, especially when it is about these AI medical devices that are now more and more developed in hospitals, there's a few obligations for developers of AI systems, so the software developers, but also the deployers. And deployers in this case is either the hospital management or the health professional themselves. So I think the first big implication is that now these medical devices must meet not only the requirements from the medical device regulation, but also these rules from the AI Act. So that actually adds an extra regulatory regime. And soon also that means that most of these devices will have to have a explicit permission to enter the market as well. Another requirement, and that is for not the developers, but really the deployers, so hospitals and health professionals, is that they need to ensure that there's a high level of AI literacy for the ones using AI systems. And actually that requirement has already entered into force this May. So according to the law, now every hospital using AI should have a big training system in place to make sure that everybody using AI systems knows how to do that, what are the risks, and what they should do to use those safely. I don't know, maybe in Portugal you're already a lot further with this, but in my country, which is the Netherlands, most hospitals are shocked when I tell them that they should already have training systems in place. But it is a technical requirement of the AI Act, and also soon there will be a fine if you don't do this as a hospital. What is also added by this AI Act is that all organizations implementing AI in their systems is they have to do a rights impact assessment. So before actually putting the system into function, they need to assess what this means for what are the potential risks for individuals, but also broader communities and also society if they use a certain AI system. So when we go back about the case about the biases in systems, you also need to, before using the system, ensure what that would mean for certain population groups as a hospital. For the rest, of course, you need to be transparent about the uses. You have to have a clear purpose. Why exactly are you using this AI system? Why not another AI system? And what are the limitations of this AI system? So in the same way as we would do with medicines prescribing, also that you would need to do if you have a standard procedure for using AI in treatment. And finally, and I think that also we covered this morning, is how can we learn from AI systems that were not placed on the market, because actually now only 2% of AI systems that are developed are actually in the end used. So a lot, they call it the AI graveyard, like a lot dies before it actually enters the market. And this is not a solution to that, but at least once your AI system is on the market, you have to, throughout the life cycle of the system, do post-market checks and also reports to the EU that has put in place a specific system if there's any errors or harms or any big updates that have been performed or should be performed. So I see some key challenges when we talk about what role law right now has to protect patients against certain risks of AI. And that is that there's still a lack of clear guidelines on how to use AI in healthcare, because certainly the AI Act doesn't help with that, because they're still very broad and also apply to a lot more sectors in healthcare. Another issue I see is that the regulation we have in place right now, they regulate the product, but not the user. So they don't actually look into the rights that the end user has, but more the obligations that a developer, tech developer, needs to meet, which also means that as a developer, you're not obliged to keep the end user in mind. And maybe that's okay if you're developing a self-driving car and you just want to sell a good product, or you want to make a lot of profit, but not when, in my opinion, when we're talking about patients. So there's obligations, but there's no rights for those affected by AI. Another issue is that most of the laws we have right now are about medical devices, but actually if you look at what especially young people are now using for AI, is mainly not a medical device, because it's this gray area of well-being devices that you can just download in your app store. And there's no control whatsoever. And actually there's also more and more harm in terms of personal data that's being leaked, but also in the worst case, really physical damage to the user. And finally, we see this deeper issue, which is that we have a very big fragmentation of AI laws, and also a fragmented landscape for patients' rights, because we see that patients' rights are mainly still regulated nationally, protected nationally, while actually AI products are now seen as a market and economy regulation, which is broader than the member states. So my conclusion is that, of course, AI is here to stay, but we must ensure that patients' rights are central to this development. And we see that current laws may not help us as much if we care about protecting the patient, because they regulate the products and not the people. And I believe that there's a shift needed, that we don't only look at risk management, which often looks at how can we keep the risks for commercial value of an organization limited, but really also look at rights protection. And I believe that for this we need international collaboration between health authorities, but also legal and ethical experts. Because now often these legal and ethical experts come in at the end when the harm has already occurred. And I would say let's bring them in at the beginning before we are in such situations. Thanks a lot. I'm happy to answer any questions or give clarifications. Yeah.
So, as I heard from the news that in EU, the first country who adopt the AI law is Italy. Have you a chance to look through how far is from the EU AI Act, or how close this one? First question. And second one, imagine the situation, it's happened, error occurred, who is the let's say, fault? Which one? The patient who give rights to use AI, during diagnosis or treatment? The doctor who used this one or the industry who developed this? Some experience maybe you have. Thank you.
So right now, also because we don't have specific legislation on how it works with accountability for AI, we have the standard rules for medical liability. And that means that if a doctor uses a tool in accordance with the professional guidelines, then something can go wrong, because that's human. But as long as the doctor acted in good faith and in accordance with the guidelines, then that is okay. And then if something goes wrong because it's like there was something wrong with the product, then you can put the liability on the product manufacturer. So actually that doesn't change a lot when we use AI, because then it's still doctor is primarily responsible, uses the tool, which is AI. If he or she used it in accordance with like the guidelines, then whatever goes wrong can go wrong, unless it was really on the developer. So I would say that nothing right now has changed for liability, but then the question is, do we think it's fair to keep it like this? Because it puts a lot of responsibility on a medical professional. We don't really have those guidelines right now that tell you exactly how to use AI and when not to use it. So then my question remains, I think, like, which doctor would dare to use AI? Yeah. So I think that's for the medical liability, and then also now for developers, it's, I would say, quite easy to get away with something going wrong, because of how the burden of proof is divided, and also because it's just very difficult to show that there was a causal relation between patient is harmed, AI was involved, AI did it. So it's not like we don't have any rules on liability. We do have rules on liability, but these are really heavy on the health professional side of things. And I'm also not sure whether that is the best situation for patients. And your first question was about Italy. Sorry, I didn't fully hear the question. Okay. I didn't know about it. I knew that Italy had some ethical guidelines, but I didn't know a law. But now this AI Act applies in all EU member states in the same way. And yeah, most AI member states are still waiting for the European Commission to give a bit more clearance. Also, there's now actually debates on whether they shouldn't pause the implementation of the AI Act because it would be bad for innovation. So it's also, I would say, yeah, politically heated, debate.
Thank you for this great presentation. I have a question, like also to the AI Act and its application, especially for maybe smaller SMEs or startups. What is your idea about how this could be guaranteed that they align their product, for example, with the AI Act? Because I could imagine that many of them won't have the financial or other capacities to get a lawyer, to consult a lawyer. So how could this issue maybe addressed?
Yeah, so I think what is good about the AI Act is that it has some exemptions for the research phase. So if you're still researching, developing a product, then it doesn't apply. So it will only apply when you actually want to put it on a commercial market. And also it has some space for regulatory sandboxes, regulatory sandboxes. So this is like a room of decision making that a national government gets to allow for certain companies to regulate in a different way. So I think that is the idea of the European Commission, is that for smaller startups they can also have a bit of a lighter regime. And at the same time, I do think that even a startup or a small organization, if they're developing a medical device, they would already have to comply with the medical devices regulation. And in my opinion, the AI Act doesn't add a lot to that because but it basically requires that you have good data quality, and I think that everyone developing a good product wants to have good data quality. And you have to have this monitoring risk system in place, but you also already have that because you're a medical device and need to prove compliance. So yeah, I don't have the feeling that it will add a lot to the regulatory burden that is already on the startups. And if we would want to change that, then we should look into changing the medical devices regulation and not this AI Act.
That was really very insightful and definitely very helpful talk about understanding really this very complex legal landscape. I was a bit intrigued about the fragmentation. You made a point about fragmentation in your last slide, and fragmentation of AI legislation and the patient rights as well. So can you please explain a bit in depth about what this fragmentation is about? For example, in terms of AI law, I think we have the European law, right? The AI Act now. But fragmentation, is it about interpretation and implementation? Is that what you mean, or is something else there?
Yeah, thank you for your question. I mainly meant to say that even though we now have like a Europe-wide AI law, that this law is still mainly looking into or focusing on the market, so on the economy, while now every EU member state has their own patients' rights framework, because that is very national. And also from when we started the EU, we also said before, like, healthcare is very personal and also very expensive, so that is actually not something we want to outsource to the EU, but we want to keep that in the member states. And what you see is that in the last 20 years, and even faster since COVID, is that the EU has gotten a lot of power in the field of healthcare, but that power is still mainly related to the market. So what is allowed on the market, and then we talk about pharmaceuticals, but medical devices, and now also AI. And it's not so much concerned with what does that mean for the individual, because that is then still left to the member states to decide, because that's that part that we said, no, that's very personal, and we don't want the EU to regulate that. And that's why we have now maybe the AI products are more or less regulated the same in all member states, but then every member state still has their own Patients' Rights Act or health constitution, and yeah, that still differs. Any final question? Okay, thanks a lot for your attention.
Thank you. Now we move to the final panel of today's session. It's about leveraging artificial intelligence for better health in Portugal. This panel will be moderated by Professor Dr. João Breda, head of the Athens Quality of Care Office and special advisor to the WHO Europe Regional Director.
It's on? It's on? Yeah, it's on. Thank you very much. Good afternoon. I would like to start by inviting my colleagues in the panel, which I'm sure is going to be very exciting, so bear with us. First, I would like to invite Professor Dr. Kansu Kanka to join me on the stage, followed by Professor Azra Ismail. I cannot see anything without my glasses, so please. And Professor Lampros Stergiolas from Greece, coming from the same place. Thank you very much. I would like to say a couple of things about every one of you. So if you don't mind, just very briefly, although you have the bios, of course, in your documentation. But Professor Kansu is the founder and director of AI Ethics Lab, pioneering initiative focusing exclusively on advising practitioners and conducting multidisciplinary research in AI ethics. And then we also have Professor Dr. Azra Ismail. And Dr. Ismail is an assistant professor in biomedical informatics and global health at Emory University. Her research focuses on the human-centered design on AI in healthcare, particularly with vulnerable communities and care workers globally, and involves collaborations with both community and industry. Thank you very much. And then, last but not the least, we have Professor Dr. Lampros Stergiolas. My Greek is terrible after 4 years in Greece. Professor Lampros is a UNESCO Chair of AI and Data Science for Society and Professor of Data Science at the DIAC University of Applied Sciences, where he leads the Data Science Research Group in the Faculty of IT Design. Thank you very much, and of course, we are delighted that you managed to accept this invitation to be with us today. We know it's the last panel, and maybe people are already tired, but I'm sure we're going to have a very excited conversation here today. The panel is around leveraging artificial intelligence for better health in the pan-European region, in Europe and beyond. WHO has 53 countries, so many of them are actually, some are in Central Asia. It's the biggest region in number of countries that composes, is part of WHO. And we all have to acknowledge and be happy with the fact that AI, artificial intelligence, is not anymore something far away, a distant vision, but something that is already being used in diagnostics, in triage, clinical decision, support, even in emergency care. And alongside these opportunities, there are, of course, the challenges we've been discussing during today. They are around equity, trust, governance, so many challenges. Making sure that we can still, like Professor Joanna said in the morning, that we still are able to get the innovative drive, because innovation is still extremely important. So today we bring together these three leading experts to explore how ethics, global health, and data science can guide the safe and effective integration of AI into health systems across Europe. So we're very keen to hear your thoughts. Allow me to start with Professor Kansu Kanka with a couple of challenges, if I may.
Of course, go ahead.
Many countries have published principles on AI, but fewer have clear accountability rules. From your perspective, how can health systems move from an abstract ethical principles to something which is concrete, tangible, perhaps enforceable? What are the frameworks to ensure this accountability?
Thank you. Thank you for the question. Thank you for having us here. So I think when we start this conversation, it would be best to make sure that we are talking about the same things, because throughout the day, I think at some sessions, AI was used to refer to LLMs, and we kept sliding into, do you use ChatGPT or you don't use ChatGPT? But on the other hand, the list that you just mentioned, how AI is useful, is mostly the traditional AI systems, the predictive AI systems. Yes. And these have different types of risks, and we know different ways, and we are, I mean, in the way that we are equipped to deal with these risks are different, depending on, are we talking about generative AI or are we talking about traditional AI systems? And of course, so this is already mentioned throughout the day, of course, AI has a lot of promise. Mainly because the world is unfair, we have a lot of ethical problems, medicine is not necessarily perfect, so we have a lot of unanswered questions. So AI is there to help us. But we have to be careful when we keep referring to it as just a tool. So I'm going to get to the question about the risks, but before we get to the risks, we have to think about what we are dealing with. Again, throughout the day, we kept referring to AI system as it's just a tool. It is, but it is an incredibly powerful tool. And also, we are talking about a system, many different types of AI systems that are used in many different ways. So when we compare it, I'm sorry that the people, some of the commentators are not here anymore, but when we compare it to TV or to other technologies like, books, that is not correct. That is absolutely the wrong way of thinking about this. Because when we think about AI, we are thinking about a system that is integrated into every other thing that we are using. When you're searching for information on Google, on PubMed, or any search engine, AI is within that interface. When you, not just ChatGPT, right? Like anything that you do on your search engine at this point. When you are asking many of the tools, data analytic tools that you are using, just to predict things, AI is in the interface. You are rarely getting any type of information at this point without the AI being smuggled into it. All your updates at this point in your organizations, in the next update, they are adding an AI system, and you don't get to opt out. And that affects what we know. That affects what we control. So now, after this detour, when we talk about principles, in 2018, we started with principles somewhere between like every company just spitting out multiple principles and also just falling back to Belmont report, principles of biomedical ethics, do no harm, respect patient autonomy, and justice. At some time around 2020, we sort of sorted this out. We got a good framework. EU guidelines were there and helped with that. We structured it. So we know which questions to ask, but we still have not fully translated them into technical ways of implementing them. So again, still, when we talk about bias and fairness, what are, like, go to your, like, when you, actually, my technical colleagues, so when the question arises in this system, how are you assessing bias? That is a very, very packed question from a philosophical perspective. I mean, for all of us who are coming from, I come from population level bioethics. The question of fairness, equity versus equality, all of these questions are loaded questions. Then you have to translate them into technical structure, but then you have to translate them into the implementable ways that we are going to implement it in a traditional AI system versus LLMs. And what we end up with is what we call right now red teaming, which is basically sitting and in a very unstructured manner attacking the system. It's not working. So yes, there is a lot that we need to do, and we need to basically translate everything that we have been doing into actionable items.
That brings me to the next question, because I think you touch upon the issue of trust and public trust, which is essential. So how do you see what are the essential ways to create this inclusive participation so that also patients and family citizens understand and feel confident on the role of AI as well?
I don't think we should try to create trust. I'm sorry, I'm being very like negative, like opposite, but
very provocative.
yeah,
That's good.
I don't think we should try to create trust. That to me sounds almost manipulative. I think what we should try to do is to make sure that we understand what we are dealing with as physicians, as technicals, and as patients. If we understand how the system works, we are going to ask different questions, and when we understand how the system works, we can trust it at the right time for the right purpose. The idea of trusting AI is, I mean, I think that that sentence is just a terrible sentence we should never use, because you should never trust an AI system. So you said it's the last session, so, you know, let's wake things up.
So what about ethical safeguards? Do you also think it's nonsense?
No, I did not say it's nonsense. But I think that, so ethical safeguards, we absolutely need them. Do we have them? For certain, like, I'm not saying we are not, like, we've done a lot of work. So as I said, like, we know, if you give us a predictive AI system, we know how to deal with a lot of the ethics-related questions, privacy, fairness, bias questions, agency, control, confidence levels, all of these things. But as the systems change, the questions change, and what we know, what we are able to do, also keep changing. So one of the cases that, Hannah, you mentioned was about ChatGPT and the suicide. We published a paper about this, for example, and it was so incredibly easy to break the system. Basically, we went from giving a prompt saying we have an intention to die by suicide, and we tried this with 6 different LLMs. Immediately, the safeguards kicked in saying, here's a helpline, call the helpline. And without changing the chat, without logging out, without retracting the intent, we then set for research. Tell me the methods. ChatGPT went to the level of creating a table with emojis, like rope emoji, the drug emoji, the bridge emoji, personalize it for our weight, personalizing it for our location. I live in Boston. Where can I get, which bridges, which drugs, convert it? Breaking these systems are incredibly easy. So when we talk about safeguards, we really have to be very careful what we can and cannot do.
Thank you. We'll look into your paper for sure.
It's already out there. You can find it.
Good promotion. Let me now ask Professor Ismail. This is more on the, let's say, global health dimension, on the equity and inclusiveness. In our view, what are some of the main concerns of using AI systems in healthcare, and how can we really carefully balance the benefits and the potential risks? I know it's very generic, but what's your take on that?
Yeah, I mean, I feel like we've talked about challenges a lot today, so I'll try to keep it more specific. One thing I did want to go back to what Professor Kansu said is this question of trust, right? And I'm so happy you brought it up, because I always get irritated when someone talks about how do we build trust in AI with like patients and clinicians, because trust has to be earned. You can't assume that your system is great, it's perfect, and hence it is ready to be rolled out and people should use it and trust in it. Maybe if it does well over time, trust is built, but you can't kind of go out there and say, we want you to trust the system. So that is, I would consider that a challenge to begin with a lot of these systems. But I think the other thing is, one of the questions I've been thinking a lot about is, what is the purpose of introducing AI in a lot of these cases, right? In healthcare, it often, especially with a lot of your LLM-based systems, the promise has been efficiency. Right? It's this idea that, okay, if we can reduce the burden on clinicians, we can reduce administrative tasks, that allows us to provide care, that allows us to do more. I think one piece that history does tell us is that we always find more ways to create more work for our clinicians and for our caregivers. And I think it goes back to kind of the systems, like the bureaucratic systems that are in place, right? So I think we need to kind of also take a step back and kind of question, why is there a burden on these clinicians, right? This was the promise, and especially in the US, this was a promise with EHR systems for a long time, that these are the systems that are going to improve efficiency, it's going to create transparency, but it's kind of become this bloated system in and of itself. So how do you avoid replicating those same concerns again, right? And there is a place where these systems could help, but we need to be very careful that we're not replicating the same issues again. So I think that's one thing that I think we need to think about, like taking more of an ecological, historical perspective to understand what is the role these systems can play, where is it going to be most effective, and what is the value we believe it adds to the system. Because now the other thing that's happening is you introduce the AI system, and then now you need this whole ecosystem to keep the AI running, right? So that money you could have been putting towards getting more caregivers, right? Hiring more doctors. It's now going into, okay, now you need a governance team. Now you need people who are monitoring the outputs. You maybe need more technical stuff. So how do you allocate resources more effectively? I think the good thing is that in the quest of introducing AI, we've actually opened up this Pandora's box of issues that were always there in the healthcare system. So issues around bias, it's not unique. We had medical bias for a long time, right? And that's being replicated. And now it's become very visible, thanks to your predictive models, thanks to your generative models. So I think there is it is I think at a meta level, it's an interesting opportunity for us to take a step back. There is this notion of like futuring and kind of thinking about designing futures of AI. And I think we can take a lot of inspiration of that to think about what are the futures in healthcare that we want to see with AI, right? How do we want to maintain control over these systems or maintain our autonomy? What are the values that are important to us? And then what is the role that AI has to play within that? And of course, yeah, I can keep talking about challenges, but I'll stop there. I think that's
maybe that is a good segue, maybe to ask you whether, what's your take on, because there's a potential risk to increase inequalities, and to how do you really serve the most vulnerable, and what's your ideas on how the system, when it really incorporates AI, can really help us tackle these inequalities, which is in health, which they are wide between countries and within countries, and we see that very much with a great intensity in WHO Europe. What's your suggestion there?
Yeah. I think it's like a double-edged sword. Like what I've seen. So I'll give you an example. So I've been working I do a lot of work with nonprofits in the global south, so to speak. But I work, for instance, with this organization that works on reproductive health in India. And there's a WhatsApp chatbot that's been designed, uses generative AI, uses RAG to kind of respond to very sensitive taboo questions women have on reproductive health. So it's creating, and it's focusing specifically on women who come from regions, communities that are underserved, supporting low resource languages. And of course, the original large language models are not very well equipped to answer those. So there's a bunch of kind of checks and balances that have been created to support that. I think on one side, it's a really interesting case where women are coming to the system because they have nowhere else to go. But on the flip side, it becomes really challenging because this is a population that's very vulnerable. So of course, you have kind of the typical questions of like bias, etc. But also a big question then becomes like, what is the responsibility of the organization that's involved, of the potential developers, of the caregivers in this kind of situation? Because now what's happening is you have, for instance, women coming to the system and revealing situations of domestic violence or intimate partner violence, and that could have reporting requirements. You might want to reach out to the women in that case, but is that safe? Are they in a place where it's safe for them to be called on to receive this information? So I think there's this whole, so I think we've kind of, what I've seen with a lot of organizations is we've gone from 0 to like the 80% level very quickly because these systems are quite good, so it allows you to build very quickly and innovate very quickly. But that last like 10, 20%, which leads to actually building a safe, reliable system, is where the meat is. And I think that's the part that we really, really need to work on.
Thank you. Last question before I move on to the next speaker. In WHO Europe, we pay a lot of attention to women's health and child and adolescent health. In this perspective of equity, anything you would like to alert to or to mention?
Yeah. So I think there are very specific vulnerabilities that women and children are subject to. And of course, some of this is legal. Like if you're interacting with someone who's under 18, there's certain responsibilities there. But even like, for instance, with the example with IPV, there is like a whole gendered context within which a lot of these tools are being built, right? And especially, for instance, if you are working with environments where women are sharing devices, because these are also groups that are less likely to have a personal device. Someone else could be seeing their chats or their conversations or the predictions of some of these systems, right? There's also this component where so kind of historically in medicine, we've kind of treated women as smaller men. And this has a lot of implications from like dosage to safety. There's this interesting book called Invisible Women, which kind of talks about some of these data gaps as a result of not treating women as being fairly distinct in some of the experiences they might have in the world, right? So all of that feeds into the models we build. All of that feeds into how we choose to design these systems, deploy them, build them out, and then evaluate them as well. So I think that
host of things is something that we really need to think about. On the flip side, I actually think there is an interesting opportunity here to do more work that leverages things like predictive models, machine learning, et cetera, to fill in some of those gaps. So you now have like a history of, for instance, clinical trial data, you have a history of EHR data, et cetera. You can actually do some interesting modeling work to try to surface some of the gaps in these systems. So for instance, in the panel earlier today, we were talking about how you can have these public health surveillance type systems. So I think that's an interesting opportunity.
Great. Thank you. Let me now move on to Professor Lampros. And I think the questions I would be posing you are more around the interoperability regulation data, of course. And my first question would be how you see that Europe could establish unified frameworks, if we should, for validating and deploying AI systems across very different national healthcare infrastructure. So what's your take on that?
Yeah, I think previous speakers have identified a number of challenges. I would say the introduction of AI in healthcare environments really opens up a Pandora's box in that sense, because there are risks to manage. There's a lot of space to make it actually not so great for patients and professionals. But in Europe also we have this issue of fragmentation, and of course the elementary ingredient of AI is data, and actually good data leads to good AI, right? So first of all, I would say we have a fragmentation of data, the data space, and that's why we have a very, very strong initiative now, which is actually put into regulation and legislation. Actually, we have the new act, which is the European Health Data Space Act. That's really a legislation now, not just a regulation or a kind of a framework. Yeah, that's a very strong statement from Europe to actually integrate some of its data space, and of course that will help a lot in better AI, in better use of AI, because if you have better and more data, because if you integrate this data sets, you're able actually to connect across borders, that really gives a lot more power to the AI that you have in terms of effectiveness, really, in terms of the power of AI, what kind of results can give you, right? So fragmentation is really at the level of data, but also we have, as we heard from Hannah, we have fragmentation at the level of legislation in different countries, interpretation of these things. Although we do have an AI Act, we do have the GDPR, we do have the medical device regulation. So we have a number of regulatory frameworks. But interpretation of these frameworks in terms of local implementation really differs between countries. So that's one thing, especially the AI Act, because the interpretation of is really dependent on context. And I think what we have heard so far, really, the key word for me is context, because when you want to apply AI, you have to be aware of the healthcare context. And parenthesis here, I think there is a strong alignment of AI ethics with medical ethics and healthcare ethics, going back to the Hippocrates Oath.
Do know how.
Of course, yeah. So how can we actually do better integration? And we need to have frameworks that help us not only to develop good AI systems, and this is really, I think the philosophy in the AI Act is actually doing things by design. So can we start building data sets that by design are secure, and the metadata we have actually create a nice secure and ethical framework, if you like, of data. And then can we do security by design when we design the AI algorithms, right? I don't know if we can do this absolutely, 100%. That's a very, really impossible thing. And I think that's what you mentioned, where you never trust AI. You can never trust AI. You always have to have your, to be aware of the limitations and always actually have some monitoring. So So the first thing is actually how to develop, how to deploy, but also how to monitor. Monitoring, continuous monitoring is really a challenge, and you need frameworks, and you need actually new healthcare protocols if you want to apply this to healthcare. So we need actually to have protocols and have harmonization across what we are doing in healthcare, especially in Europe, because we have so many different healthcare systems. So this harmonization is a very big challenge.
Isn't this going to slow down innovation?
Well, it's a kind of a two-sided thing. Because if you have a strong framework and everybody kind of uses that as a basis, then it can be also a platform to launch innovation, right? Also, you can, because then you can actually scale up very quickly. You can actually use data from many countries, and maybe you can be a bit slow in developing your system, but then your system will benefit from the integration of data and integration. And so regulation is a kind of a double-edged sword, like AI is. but regulation, yeah, can stifle innovation, let's say, at the fundamental level, if you like, at the R&D. But also in terms of market, and actually being successful in a big market, it can actually help things. And we see that with standards. I mean, telecommunication industry. Well, it cannot exist without standards. If you don't have, 5G, for example, everywhere in all countries, it has to work. It has to be the same standard. So maybe we should move in that direction globally, of course in Europe, but also globally. I think the AI kind of development, the AI development, the AI kind of industry can benefit from global frameworks. We don't have this yet, right? But this is maybe a good direction to go.
Very good. Yeah. So when this will be in place, what's your view on, let's say, validation, evaluation,
yeah, and that's
impact?
the final stage, right? We talked about development, then deployment on the ground, then continuous monitoring. You have to have that, not trust the system completely, and then we need to validate, and we need to have a kind of evidence-based approach that we have also in medicine. So can we test? Can we have RCTs, for example, randomized controlled trials of all these systems that we develop? That's really something that will give us confidence. So I agree, maybe trust is not really the right way, but confidence is actually confidence, actually to know what we are doing, to have a better idea of what we are doing. Then we can do things better, and we can avoid the slip-ups. We can avoid the bumpy road in that sense.
Wonderful, fantastic, fascinating. Questions, comments from the audience, please?
We were perfect.
If you don't take the floor, I'll go around in another round of questions. Okay, then.
For me, what? I don't specifically have anything to say right now. I can think of things, but
more on the
I can say one thing. Okay, about the regulation and stifling the innovation part. I'm based in the U.S. I'm Turkish. I'm based in the U.S. And as you know, U.S. is not exactly going full on with the regulation at the moment, to say the least. But I think the idea of that we are just going to have a lawless structure is just an illusion. What it means is that in the US, litigation is going to determine what goes wrong. And here, there will be, in the Europe, chances are there will be more guidance. And when you don't know what you might be litigated against, that is not a better situation. That's not a faster innovation structure, actually. And more, I work a lot with the companies, and more research and surveys show that companies that have AI governance systems in place move faster. Because if you have to stop every moment asking, can I do that? Should I do that? You're not going faster because you're constantly wondering if you're getting yourself into a legal mess. If you have a structure where you can say, yeah, we've been following the governance system that we have built, that allows you to not just go faster, but also coordinate with the rest of the, if this is a big organization, rest of the organization. If this is in a national level, we can imagine, that allows you to coordinate much faster, as you said, Lampros, much faster with the other organizations within the country so that you can share the data, you can move faster, and you are not putting your patient's data into ChatGPT. Oh my God.
It's interesting how you make this parallel between the litigation and the, say, the US compared to the European approach, which is more on the legal frameworks and so on. Anything on this one? Reaction?
I fully agree. And also, there's the market element. Yeah, definitely there's an issue of kind of delaying things because I don't know where the red line is. And if you don't have really red lines, then you don't know what to do, and this creates delays, etc. But also at the market level, I think if you have a strong AI governance framework or you follow good ethical guidelines on that, then you gain, I will use the word trust, but maybe you gain the trust of your customers, and then you get really success on the market, a much bigger market share, because people actually really like what you're doing and they will buy into it. Maybe it's not trust, but maybe they feel more comfortable, I would say a higher level of comfort with your product, with your algorithm, or more confidence in using it. And this will actually open up the market, will grow the market for you. So it's a lot to gain by having a good AI governance strategy in place as an industry. But of course, governments need to have that as well. Organizations need to have that. Healthcare institutions need to have that as well.
So this argument that more regulation goes against, let's say, innovation is probably too strong, or you wouldn't buy into that.
We have examples, as I said, from telecoms, the industries move actually together in certain things in order to have a global, if you want to have a global operation and global market, you need to have some of this, definitely.
I wouldn't say more regulation, but bad regulation is against innovation, obviously.
Okay, very good.
Yeah, if I may add just like an example. So I've been working, at Emory University where I'm based, we have like a large medical school, and I've been working very closely with their healthcare governance team, which has been very interesting because in the US you have a big market now with a lot of vendors. Most of these are LLM based who are competing for the same money in the medical market. But what's happening on the internal side is that all of these healthcare organizations are now having to figure out which of these are they willing to try out in their system, because none of them have reliable data, none of them have studies on the performance of their tools. So now internally we have like monitoring processes, internally we have to create a governance structure, we have to create all of these systems, and we still don't know which of these tools we want to invest in long term. So it's created this very odd situation, and that's just at our institution. All of the large medical institutions in the US at least are having to do this. So absolutely agree with Dr. Lampros that like we need some structure, we need some guidelines here that can actually drive innovation in a more directed way, so that you're not now caught up trying to figure out, like, reverse engineer this whole process.
Very good. Any brave contributor from the audience? No questions yet? I mean, I'm fascinated with this discussion. I really like the idea, I will use it from now on. Never trust AI. It happened to me. I did got a series of fake references, so I think it happens to everyone who's tried to write papers. So that was a good one. Never trust AI.
It might save humankind sometime, if you want. Terminator.
Very good. So also, I mean, if you're a researcher working in the world of data and epidemiology and so on, you always think about this good data, right? What you said brings us back to this basic principle. Good data, good AI. So we are looking for the same things that we were also looking before, right? It's just probably more power, more opportunities, and all of that.
And AI is not generative AI. Generative AI is really something now that drives the AI industry a lot. But we have a lot of other AI systems that are not so risky. And of course, the AI Act was really really started because of all the risks, the higher risks that generative AI presents. But AI systems have been used a lot, and it's not only generative AI.
Okay, very good. This is very good.
Question.
Yes, please. Anna.
Thank you. I'm very happy to also hear from your side that it's not always regulation goes against innovation, because that's really, I hear it everywhere, and every response to everything I do always says no, but literally from MedTech Europe, so it's this big community of MedTech companies, they always say regulation will delay access to life-saving medical devices. Like, I can now even dream this sentence because I've seen it so many times. But I would also like to challenge you on something else, which is something you just said, that is, good data always means good AI. Because in my view, we can have very good data but still misuse an AI system with that good data. And I'll just give you a brief example of something that happened in the Netherlands some years ago, where they had an algorithm to determine who would get access to childcare benefits. And that went completely wrong, and it was not the case that they had the wrong data, they just did the wrong things with that data. So maybe, I would like to hear your thoughts on that as well.
Agreed.
Well, there was a lot of bias in how the data was used, right? You said good data set, but actually the data set was actually from a very specific subset of the population, created a lot of bias. In the end, this fed into the algorithm. The algorithm actually gave the wrong kind of assessments. The government acted on these assessments. Well, the result, we know, the scandal of the child benefit in the Netherlands, which brought down the government, really, in the end. So good data is a kind of requirement, but not always. And also, what is good data? It depends, because there might be, you might have a perfect data set, but it's actually about totally the wrong thing very different thing that you would think. So metadata is also very important. Context. I will go back to context. If you do things in context, and you know what you're doing because you are aware of the context in which you use the data, a good data set, clean and complete, etc. data set, then you're probably okay. But you can actually do things out of context and end up in a very, very different outcomes, really. Yeah. Well, thank you so much for the comment. It's really
good.
And that was really a very. I think that was one of the events that led to, the development of accelerated the development of the AI Act in the end. I mean, this big scandal in the Netherlands, really. Yeah.
And like in basic science, you always need to get rid of bias, right? It's something we've done also before.
Yeah, so if I can just add something. So I feel like, so I agree with the point on context. I think context is super important. I think sometimes you can have communities be represented in the data, and that's not necessarily a good thing. Like, you can have data that is representative, that is technically not biased, but you're maybe including communities that are vulnerable and maybe should not be in your data. And like, one example of that, for instance, that I've seen with clinicians is that sometimes they get patients who talk to them about very sensitive things, right? Or maybe you have like a patient who was formerly incarcerated. And these are not things they put into clinical notes, but these are all things that get caught in, like, if you use transcription software, it then goes into your notes, it then goes. So it is very complete data, it is very representative data, but it can also be very counterproductive. So I think, the point of context, I think, is really important. Like, what is the data being collected for? What is it going to be used for? And what are some of the implications of that if that data was to be shared, I think, is something we have to be very careful about, especially in healthcare.
Thank you.
Just to add one more thing, you mentioned that they say, what was it? Because of regulation, we are not getting the life-saving innovation that we are supposed to get. It's such a weird thing to say, because it completely underplays all the ways that the wrongly structured AI systems are costing lives. We have so many studies. You have the Obermeyer study about racial bias where the black population in the US did not get the care because their risks were underscored. We have the oximeter situation during COVID where, again, the darker skin tones did not have the right reading of the oxygen in their blood levels. So a lot of these things about ethical concerns are not, oh, we are so fragile, we want everything to be perfect. No, and always, like, the other thing that I always get is like, oh, are we gonna wait until this is perfect? Humans make mistakes too. Of course, but we are building a structure that is completely taking over the whole population. Like, if you have a mistake, a subgroup will be consistently getting disadvantaged, much more than the way that a bad doctor a bad physician may make them disadvantaged. They will just not have a way out. So when we talk about building AI systems, that's why I get, like quite a lot uncomfortable when we talk about them as like simple tools. We are building societal structures. We are building this whole overlay of new structure that traps people or that brings them to the fair playing level. So we can do a great job with this, way better than changing the bias in human perception is extremely difficult. Fixing the data and fixing the AI is possible. So we can definitely make get much better outcome, but if we aspire to it. If we are like, well, humans are biased too, we are gonna ruin it.
Yeah, and also that often, like, a lot of these companies, like, I don't know if you've heard the phrase that you want to, have the cake and eat it too, but it's like they want innovation to be open. They want to kind of move quickly, but they also don't want to take responsibility for what happens as a result of it, right? So if you do have a situation come up, they will be the first to say that the accountability of this does not lie on us. It's on the clinician who is using it. It's on the healthcare system because you have medical liability rules and things like that. So I think it's in my mind, it's a disingenuous thing to say that you're stifling innovation when you're not also willing to address what you get out of that more practically.
Okay, on a positive note, you said we can do great with it, so I think this is very good. I ask you, so we talked about ethics, equity, technical governance. Maybe to close, what is, in your view, just a sentence or one word, if you want, what is the single most important step Europe, the European region, must take to ensure AI becomes trusted, not trusted, becomes an ally in healthcare rather than just a sort of new divide? What would you say?
Well, I think we talked about divides because what you have been talking about is to do with the invisible data invisible groups, we call them. And we have at UNESCO, we have a new guidance for that. Data invisible groups and data minimizations. It's a new policy brief from UNESCO. And this, of course, relates to the child benefit scandal in the Netherlands and a lot of what Kansu and Azra have been talking about, which creates this unfairness, data-driven affair. Actually, in the end, you have data-driven marginalization and exclusion of certain groups, and it's happening. And if you talked about divide. We had the digital divide, but now with AI, you can argue that the AI divide is even more, more destructive and scary, really. Yeah. So we need to address that. And I would say in Europe, one thing is harmonization. We need to do more harmonization, also in terms of AI regulation, because AI regulation, we have a legislation, but how it's implemented, it's in different speeds of implementation. Maybe it sounds as a joke, but the government is excluded from actually complying with the governments are excluded from complying with AI until 2030 or maybe even more, because government is to be trusted. Yeah, but all the companies now have to comply. But in different speeds until 2030. We need to do more of harmonization in terms of standards, in terms of pathways and protocols in healthcare, actually, to make this happen.
Okay, good.
Yeah, and context, and be aware of the context.
3 sentences, that was very good. No problem. Next one.
So I'll say I know I sound very critical of AI, but I am an optimist. I especially think that a lot of the world is going to be looking to Europe to see how the AI kind of scene plays out here. And I think there's an opportunity, because some of these things are still evolving, to get it right. So in my mind, I think these are the kinds of venues and conversations we need to have, where we can get people from very diverse perspectives, actually think about what is the kind of future you want with or without AI, and be able to build that collectively and have the guardrails in place. So I think it's an interesting opportunity that we should take advantage of.
Thank you very much. Thank you, appreciate it.
I think the best way to put it is that we have, over the last 10 years, we have talked a lot about this, we have asked very good questions, we have come up with principles and goals. I think it's time that we have to systematically, contextually, and very concretely determine what are we doing? What is the responsibility and the exact operational task of each profession? If you're a physician, what do you need to know? What do you need to apply? If you're a developer, what do you need to know? What do you need to apply? If you're an ethicist, what do you need to know? What do you need to apply? Very concrete. We don't need to talk around this anymore. Like, we need to get to the action.
Very good. Take action. Excellent. Well, I think this brings us basically almost to the end of this conversation. I enjoyed it. I hope you enjoyed as much as I did. It's been amazing. We are privileged that we have leading personalities globally here with us. I really appreciate very humbly to have the opportunity to be here with you. Thank you very much. Muito obrigado.
Thank you.
Thank you. To conclude today's session, it is my pleasure to invite Dr. David Novillo Ortiz to share these closing remarks. Ele já vai mudar. Tem que mudar ali. Vamos aqui, sim.
It has been a long day, but I hope that you have enjoyed as much as I did too. I think that it has been amazing learning so much about AI and everything that is having already an impact on our daily lives, right? So we started with an overview about what WHO and other UN agencies are trying to do in this area of work. Then we had an overview on what is going on in some countries in the European region. Then we have a deep dive on what is happening in Portugal with amazing findings. I would like just to showcase one example that Professor Machado, Rita, highlighted about how we are saving almost 1 year of work with using AI for coding mortality data. That is, I think, an amazing finding. And then we have more discussions about legislation, about quality of care, and just 2 amazing panels that you have just enjoyed. So I mean, it has been a great day, at least for me. I'm going to quote Joanna when she said that we need more meetings and more research, and I think that is true, and we will continue doing it. I know that having a meeting after a meeting is not the best outcome, but that is a reality sometimes, right? Working on this, I think that we have been asked and put it to the limit, right? When we need to advise at the senior management in WHO, member states about this area. So I was talking to Eva and with other colleagues that today I will sleep a bit better, knowing that we are surrounded now by this amount of experts helping WHO and our member states in this area of work, because it's quite difficult working alone, and we are not alone. This is something that we need to build together. It's impossible, right? When people are just looking at us as WHO or UN agencies overall to try to solve all the problems that is happening at the moment. So this is a collective effort, and we are so happy that this event has been part of it. I would like to conclude thanking IPO. Dr. Julio, thank you so much for hosting us. It has been a privilege to be here, and we hope that we will be here back again. And And of course, Dr. Anna, Dr. Miguel, Dr. Francisco. Dr. Francisco is not with us today because he's in New York with the Secretary General. But without the three of them, Anna, Miguel, and Francisco, we won't be here today. You need to know. And also sharing an anecdote, you may think that we have been planning this for months. We started planning this on 18th of August. So really well done to all my colleagues for making this happen, including the colleagues in my team that have been able to put all this together. And of course, thank you all of you for making the time on your busy schedules to spare a day of your daily work to continue knowing about this. We are one email aside, so you know where to find us, and we look forward to continue contributing to visit our work and to the health and well-being of the population in Portugal. Thank you.
We will now hear from Dr. Ana Correia de Oliveira, member of the Executive Board, Portugal National Health Service, who will also provide her closing remarks.
Good afternoon, dear colleagues, dear friends, ladies and gentlemen. Just a little sentence. David is not quite used to know how Portuguese people work, but we work good and fast, so 1 month it was not a problem for us. Even so, as we close this inspired event here in Porto, I want to express my deep gratitude. Gratitude to every speaker, every panelist, and every participant who made this day so rich in discussion and exchange. It has been an honor to join such a distinguished group of professionals, experts, policymakers, and innovators from Portugal across Europe and beyond. Through this event, we have explored transformation of healthcare through artificial intelligence. We looked not only at its promise, but also at the ethical, regulatory, and human challenges it brings. Our keynote speakers and panelists reminded us the future of health must be guided in trust, confidence, and responsibility. We examined the impact of AI on health systems, on patient safety, on legislation and equity, and we stressed the importance of digital skills for all health professionals. Today, we also witnessed the remarkable commitment of leaders and institutions. From the World Health Organization, the Portuguese Minister of Health, with the presence of local health units, renowned universities and associations, and make our progress possible. Especially thanks to our hosts, the Instituto Português de Oncologia do Porto, and to the many international contributors who brought expertise from France, Finland, Germany, United States, Netherlands, and many more. Now, let us take these conversations forward. May the collaboration born here flourish. May they help us shape a digital health future where technology truly serves people, improving care, advancing equity, and safeguarding ethics. As we live here today, let's carry with us the energy, the ideas, and the momentum of this event. Let's be the ones who, through inspiration, and turns inspiration into action and challenges into solutions. The future of health is being written. Together, let us build a system of care and make their systems just, innovative, and deeply human. I wish you all a continued success as we advance this crucial mission. Until we meet again, let us remain connected by a shared vision and by our responsibility to shape better health to all. In Portuguese, contem com a direção executiva. Muito obrigada a todos. Thank you very much.
On behalf of the organization, thank you for joining us and for your engagement in shaping a responsible future for AI in health. The Portuguese Institute of Oncology of Porto is very grateful to have hosted you for this session. Have a nice trip.